Hello, thanks for coming. My name is Leandro Giatti. I'm associate professor at the School of Public Health, University of São Paulo. I work for the Department of Environmental Health. We are very glad to be presenting this seminar today with this title, Adaptability of Vulnerable Communities and Youth in the Post-Pandemic Cities. We are going to have two panels. This seminar is a joint effort of international collaboration of a research project involving Brazil, South Africa, UK. So we have colleagues from different universities which are collaborating in this research. And the seminar will discuss the challenges that COVID-19 pandemic has presented to life in large cities, focusing on adaptation strategies for children, young people, and communities living in contexts of urban vulnerability. As I told, this meeting is a part of the process of the research. So we are going to bring some insights from the beginning of the data collection for the research, but also this is going to be important for us to make a good reflection about our conceptual basis and having also other ideas and insights that can be relevant for our ongoing project. So we are going to have two roundtables, and now I will moderate the first one because we have three panelists and one moderator that we are calling for promoting a debate. Okay, so at first I would like to invite Professor Abraham Matamanda. Please join us. You're gonna make the first speech. So Professor Matamanda is an urban and regional planner who has also been trained as a social ecologist. Abraham is currently a lecturer in the Department of Geography, University of Free State, South Africa. He is currently research focused on climate change adaptation, informal urbanism in the Global South, medical geography, planning for urban food systems, and urban political economy. Thank you for coming, Professor. We're going to make the first presentation. You're gonna stay there to share. Yes, your slides. Yeah. Okay. Thank you. So also, as a panelist in this first round, Professor Lauren Anders, please join us. Thank you for coming, Lauren. She joined the Bartlett School of Planning at the University College of London in January 2020. She started there as associate professor in urban planning and was promoted for a full professor in 2022. That's great. So she was previously a senior lecturer in spatial planning at the University of Birmingham. And is originally trained in France as an urban geographer and urban planner. She completed a PhD in urban planning in 2008 at the Instituto, University Pierre Mendes, France. Sorry, where she was also lecturing between 2004 and 2008. So thank you for coming. And also our third panelist for this first section, Stuart Paul Denon Stevens, who is an academic and town planner working to understand how we can create better places to live and work. Currently, he's a lecturer at Nottingham Trent University, UK. His expertise includes basic and applied research, policy development, and development control. He has researched various topics, including housing, spatial planning for mining towns, planning practices in education, and zoning. Thank you for coming, Stuart. We are very glad to have all of you. And to help us moderating and promoting a debate, I'm going to invite my colleague from the Department of Environmental Health, Professor Gabriela Marques de Julio, who is Associate Professor at the School of Public Health, University of São Paulo. She was recently a visiting researcher at the University of York, UK. Di Giulio holds a PhD in Environment Society, University of Campinas, Unicamp. She co-heads the research group on environment and society here at the Institute at Advanced Studies, and integrates the Interdisciplinary Climate Investigation Center, the INCLINE, a center of the USP. She currently research program focuses on the human dimension of climate change, crisis, risks, uncertainties, and science policy communication, interactions, global health, and sustainability. Thank you very much for joining us, Gabriela. So before starting, it's important to remark for those that are watching us through YouTube, in the description of the video, we have the email address for sending any questions. In Portuguese, we say the email iea responde@usp.br. That's it. So we are going to have a very dynamic conversation. We will have a first round for the panelists to speak 5 minutes each, making a presentation of the ideas connected to this first panel. And after, we will have 2 other rounds with questions. So by now, just to remember, the theme of our panel is Learning from COVID-19 and Planning Cities in the Post-Pandemic, Youth Agency and Vulnerable Communities. Now, I invite Abram to start, please. You have your first 5 minutes. Thank you.
Hello, everyone. Yeah, I think most of the work that we've been... Oh, okay. Hi, everyone. I think since the pandemic had started, most of the work that we have been conducting with some of my colleagues have mostly centered on the vulnerable groups. And we have situated our work mostly in South Africa, Zimbabwe, Lesotho. So this is more vulnerable spaces in terms of there are a lot of, beyond the pandemic, there are a lot of challenges that these countries have actually been facing as well. So when the pandemic came, it even made it actually worse as well. So just to give a brief background of these 3 contexts where I conduct most of my research, Lesotho is a very small country that is more like within South Africa. And surprisingly, it's one of the countries that recorded the last COVID case in Africa. And then there's been, when the COVID pandemic came, there were a lot of political unrest that were happening there, and also an economic crisis that was currently there, and the levels of poverty there, they tend to be very, very high. Then South Africa tends to be the big brother in Southern Africa in terms of it is more of a well-functioning economy. But the challenge that it has been facing over the past years has been some misgovernance, high levels of corruption, and surprisingly, it is one of the countries that had the highest COVID-19 rates in Africa. I think it was next to Algeria and Tunisia, but in Southern Africa, it was one of the most affected countries, and it had also a higher number of deaths that were recorded there. Then the Gini coefficient in South Africa is also very high, which shows the disparities between the have and the have-nots as well. Then looking at Zimbabwe, it's a very, very a special case in terms of relatively the misgovernance has been very prevalent there, I think, for the past 2 decades, and the economic crisis as well. So, and the political unrest, which also have been happening in the past years as well. Then relatively, the rates of COVID-19 were kind of high. And also during the pandemic, South Africa freed some of the convicts that were in its jails and repatriated them back to Zimbabwe as well. So that also had an impact in how the COVID cases also went up as well. So this is just a context of where we conduct our research. These are images from some poor communities in South Africa, Bloemfontein, which shows the level of lack of basic services. So as you can see, there are those young boys who are collecting water, and this is a communal tap where everyone comes to collect water there. So one thing that came to mind is how could you undertake social distancing in this kind of context? Then you can see in the background the green structures. Those are housing shacks, which are built using corrugated iron sheets. So you could actually imagine when people were asked to be staying indoors, and then the temperatures in the Free State can be very high and very low depending on summer and winter. So it became very unbearable being under these conditions where people were asked to be locked down in this kind of situations as well. Then the second image, it's actually a picture that shows the type of road infrastructure that is there. And when there's an emergency that has to be happening, ambulances sometimes find it very difficult to reach these spaces. And then it also speaks of the emergency that happens in these spaces as well. So the key issues that these poor people normally face is the urban penalty of the poor, where they actually suffer more by being poor. Then there's also Blitz, which was undertaken during the pandemic as well. So the government, to some extent, they took it as a strategy to address some of the unwanted issues in the cities, especially informality as well. Then here you can actually see there's people living in crowded spaces, which is very, very prevalent as well, lacking ventilation and no ablution facilities as well. Then there's limited primary health care facilities in these communities. Then another issue that also Southern Africa grapples with, which also made it very difficult with COVID-19, is the high prevalence of underlying conditions such as HIV, AIDS, TB, and diabetes as well. So this is just some of the government responses that happened during the pandemic. So the picture on the left, it's some images of the police impounding some vegetables from some informal vendors, which were meant to be distributed. Kind of, these are fruit and vegetable sellers that were being not recognized as essential workers. And how did this now affect the food value chain as well? Then on the right as well, those are informal sector people. These images are from Harare, where the blitz happened just when the lockdown was announced. The municipality took it as an opportunity to eradicate the informality. Then, so these are just some pointers from the research that I've conducted, which I found that the pandemic, to some extent, it was used as a scapegoat by the government to conceal, to cover their mismanagement. Then challenges with value chains, especially urban informal food markets. Then tactical ways in which the poor appropriated space, e.g. went digital. So some of those people that were in those informal sector, they ended up doing some digital marketing and selling of their products. And then some started operating from their homes. And then there was also an equal approach to ways in which the government responded to the pandemic. So this is just a general of the issues that I've been tackling over these past 3-4 years in COVID. And yeah, I think we'll engage more in the question and answer session. Thank you, Leandro.
So where I'm coming from in regards to this. So something which has been at the core of my research essentially for the sort of past 15 years or so is really this interest into urban transformation. And for me, of course, the pandemic is a key, massive urban transformation. It was an unprecedented event. And in relation really to this feeds into any thoughts I've been giving on regeneration, on sustainability, and those kind of really of key concepts that are at the core of our research when we work essentially on cities and when we're working and looking essentially at vulnerable communities. The other thing which is really at the core of my work is what I call temporary urbanism. So it's essentially, it's when we're looking at cities, it's the role of temporary uses of space, temporary adaptations. So essentially how practices, but also buildings can be used differently and for a short period of time in order really to serve specific needs. And this is really in relation to this that I've been looking at urban transformation, urban regeneration actually across the globe. And in relation to this, I'm really interested in rhythm and the fact that when we're reading cities, what is of interest for us as researchers is to understand the fact that it's not linear. There's a lot of rhythms. There's a lot essentially of processes happening of different durations. And essentially those reasons have huge impact on people, on policies, on cities, and especially when we start looking at everyday rhythm. And my interest really towards vulnerable communities has been in relation to the everyday, and especially in relation to how everyday rhythms connect to everyday resilience and how essentially this is participating to the changes and the transformations of space. I did mention adaptations and resilience already, but in relation to this, again, something that has been very much at the core of my work for the past sort of 10, 15 years has been the idea of coping. So how through transformation, how through temporary initiatives, places, but also people essentially are coping, are surviving, and are essentially, in some cases, thank God, really moving towards more positive life trajectories. In relation to vulnerable communities as well, and as per my planning background, I'm really interested in looking at what we call hidden voices. So those essentially often who are forgotten from policy and those to which essentially to whom we need to give a voice. Just in relation to the COVID pandemic, I wanted just to flag up a couple of sort of key papers that I've been publishing in the past 4 years or so, just again to give a glimpse of how I've been looking at the pandemic through different lenses and actually in different contexts. So I've been looking at the impact of the pandemic, really looking at the impact on people, on places, on policy, and through different lenses. So typically the idea of, again, temporary urbanism, and especially here looking at what it meant in the UK, in Lebanon, in the US, so in a range of different contexts where communities have coped through temporary urbanism, but also how temporary urbanism was key in helping actually to deliver health-led measures in relation to preventive measures, but also helping communities to cope, especially in relation to well-being, in relation to being able to go outside, to exercise, etc. And the other thing I've been looking at when we're looking at pandemic and cities is really what it means when we're thinking about health, noting that us in planning, we kind of moved away initially of looking at that aspect of health in terms of virus. And the fact that in terms of adaptability, we don't actually really know how to plan in an adaptable way. Planning is very regulatory, planning is very rigid. And the whole point of my work is really to try really to enforce the need for more adaptability in the way we're thinking about city and the way we are planning cities, because this is really a way forward in order to understand and try to make better lives for those living in cities. And the final thing I want to say, which relates to one of the papers also I've been working on, is the urban geography one, is also thinking about what is really going to be the impact of the pandemic. There's a lot of thoughts currently going into what is going to be the legacy of the pandemic. We know that the pandemic led to a lot of accelerations. We know that the pandemic really reinforced intersectional inequalities in cities. And I'm really interested into thinking about what new models are going to come through and essentially how our understanding and reading of cities is going to change in that aspect. I just want to flag up 3 core projects that were linked really to this, and I will get back to that in the debates. So we have our core PANEX-YOUTH project, for whom essentially all of us here are here, and I'm sure we'll pick up on this. And in relation also to this, and in relation to places and adaptability, I've been working in global cities in London and New York, and now also in Paris and Tokyo, trying really to understand how public spaces, streets, parks have evolved, have adapted during the pandemic, and what can be essentially the legacy in that respect. So really a couple of key sort of points, and this is my final slide, in order really to build on the discussion and trying to integrate really the future of sort of pandemic research and how we're thinking about cities. I already mentioned intersectionality. I think that's a concept we need to build on and discuss further. Similarly to path dependency, because we know that everything that happened to the pandemic was very much dependent on what happened before. One of the key problems of the pandemic was the fact that overall it was a global response, which was ignoring local needs, place-based approaches, and this led essentially to key impact on the most vulnerable. We know that the state, and I see here the state, the government in all countries essentially really didn't do enough, didn't respond essentially in a way that could essentially really help the most vulnerable to cope. We need also to bear in mind that there's no actually really discussion or recovery currently. we are in a state of ongoing crisis and we need really to work around this. The other thing as well that came very strongly when we're looking and thinking of the pandemic, and this was reflected already in what Abraham was saying, is the role of the bottom-up. Community, organization, charities just got together. And this was very much based on skills, on knowledge, but also on time, especially if we're looking at what happened in cities like London and New York. And again, I can come back to this. And just in relation to adaptability, I think my whole point here is we need to learn from the pandemic to move from reactive adaptability, just doing because we are in a crisis, to actually really thinking about it and bringing a proactive approach. And in relation really to the young people, which are at the core of the session here, my work, and especially the work we're doing through PANEX, really is in line to just 4 key things. First, young people haven't been at the core, haven't been a priority all across the countries in relation to the pandemic, their needs, how they were affected by the pandemic, and how they are still affected by the pandemic. Their rights, their needs were not addressed, and we really need, as researchers, to really be at the forefront to try to make their voices heard. What we don't want is really to have a lost generation. And I put here this as a question mark because this is not what we want, but we need to be careful that we're not heading actually in the direction for some specific category of young people who are really suffering and still suffering really from the pandemic. And really we need to see it as an intersectional crisis where a lot of the key aspects of young people's life has been affected, from food, education, access to play, leisure, but also health, mental health, employment. So all this needs to be our core of our thinking. Thank you.
Okay, thank you, Laurie. Now, Stuart, please. So after this round, we will not need to change the chairs anymore.
Yeah. We're definitely doing musical chairs right now. Okay, so what I'm bringing is a bit more of a perspective in the sense that this is more kind of questions and answers at this particular point. My own background is I'm originally from South Africa, and I've done most of my work in South Africa. And in the last 18 months, I've moved to the UK. And one of the questions, especially looking at this kind of question of young people and vulnerability, but in terms of general questions, saying, and also working with something like the PANEX project, is saying, how do we use the perspective of UK, Brazil, and South Africa to look at each country's questions of housing and adequacy, and some of the assumptions that go into it. One of the things coming to the UK, supposedly a very wealthy economy, but still seeing extreme cases of poverty and these perceptions of poverty. Yeah, so what I wanted to do with this first slide is just kind of make the point in terms of where South Africa, UK, and Brazil kind of sit. You know, in the case of somewhere like UK, very wealthy, so 0.49% of the population living on less than $3.65 a day. However, in terms of perceived and lived poverty, much higher in terms of the UK, at least in terms of that perspective as well. Somewhere like South Africa, we're talking about 40%, and then in terms of things like unemployment, we're talking 34.7% as an example. So just in terms of putting in perspective, it's almost be careful going too far with this, but kind of seeing Brazil almost as a middle ground between UK and South Africa. And I think Arben always makes a point sometimes with me is that sometimes say South Africa is a little bit of extreme, but even places like Zimbabwe probably a little bit more extreme. So in terms of questions of what constitutes a good house, and it's thinking about the questions in the 3 countries, what would count as social housing, and you wouldn't believe it, but that is supposedly a social housing scheme in the UK. I actually live in a house that's not this one, but it's basically of the same kind of quality as an example. So kind of young people and vulnerability, and coming to the key questions with this, if I mean, there are more than these dimensions, but 2 big dimensions. In terms of learning, it's a question of, do current housing standards support an environment that's conducive to learning? And from a COVID perspective, one of the questions to ask is the learning conditions that occurred during COVID as a stress test to say is, can our homes support learning? What we saw during COVID, what kind of lessons do we have from that from a post-pandemic perspective in terms of that? Privacy and dignity. Do current standards provide dignity space for children and what they claim as their own? So kind of just looking at these images, and the first one would be something like a social housing scheme in Nottingham, and then just to give an example of a floor plan. So from UK space standards, it varies a little bit, but between 71 and about 79 square meters would be counted as the minimum floor size for a 2-bed unit as well. So this would probably be, if there were 4 people, this will be overcrowded or below the space standards. If it's 71, 3 people, etc., that would fall within that. Compare that to somewhere like South Africa, and there's been substantial state building of homes between 94 and 94 and about late 2019, somewhere around about there, almost about 4 million homes built. But built in a structure like this, which will often be between 40 and 50 square meters, single story. But at least, and I think the one thing to note between these two is while the UK places a large emphasis on kind of the square meters for the whole dwelling, as an example, 76. If you look at the bedroom spaces, bedrooms are slightly less regulated and can be vary between about 8 and 10. So in the South African case, 40 to 50 for the whole dwelling, but bedroom space is about 9 square meters, as an example. Just kind of coming to link a little bit to what Abram was talking about, this is kind of a state-built home. A good portion of the population still live very much in zinc shacks that look like this, as an example. So, I mean, that could easily be a 15 square meter structure, which you might have 3 or 4 people living in. And a strange byproduct. So Cape Town, where I'm using these images, is not always the best for the whole country. But often what you'll see is a state-built home like this being built, and then in the garden, a shack or backyard shack being built as a second or third dwelling unit as a perspective as well. So young people and vulnerability, and kind of coming to the questions with in terms of learning environments. There's a question in terms of a space like this. If you're 40 square meters, very poorly built walls, sound travels, 3-4 people in that as well. Can you actually learn in a space like this? And I think that's one thing to think about. Brazil, South Africa, and UK, very similar learning strategies. And part of the learning strategies is the idea of homework, that you can go home and do work and you bring it to school the next day. There's a question in the South African context of if you're living in a house like this, or you're living in a house like this, is the idea of homework even possible? Is it equitable to rely on a learning strategy in which someone might be living in a 100 square meter home, and then you've got another learner in the 15 square meter house, etc., as well? So one of the questions, and I think with COVID and the belief that people could learn from home, was proven to be very questionable. Under normal conditions, in which we live now, I would still even ask the question in the South African context is these spaces conducive to learning? No. But given the context of poverty in South Africa, that might be more of an adaptation in terms of learning strategies. The question is for somewhere like the UK, which supposedly is more wealthy, but we still find, if you look at the figures in the UK, that 1 in 6 homes, it's slightly questionable, but one of the estimates would say about 1 in 6 homes are overcrowded. Some more recent research, I think it was Andrews, that they've looked at, found that only about, I think secondary school learners, only about 75% had a dedicated space for learning for themselves that they weren't sharing or having any. For secondary school, for primary school learners, I think it was less than 50% as an example. So one of the questions in terms of learning, in terms of young people, in terms of vulnerability, in terms of housing standards is, if we have to put the right standards down, what does that look like? One of the questions I'm starting to challenge, or starting to at least ask the question about, is it right to look at the whole house? Are things like bedroom sizes and having dedicated spaces more important from a housing standards perspective? And also questions such as unit mix. There's no real regulation in the UK to say that social housing has to be 1 bed, 2 bed, 3 bed. It does vary a little bit from local authority, and a lot of local authorities wouldn't have the guidance. There is a question to say is, would a standard that requires 3 beds or at least a large proportion of social housing to be 3 beds or more potentially be more conducive to learning, and more regulation around bedroom space, but possibly looking at things like, do we allow for smaller bedrooms while mandating more bedrooms? Do we also put standards towards smaller homes, but then trying to actually look at the functionality of those homes and putting a lot more of the regulation around it as well? I think just the thing to finish, just knowing we're out of time with this, was also the question of kind of dignity and privacy. As much as I've talked about the learning question, it's also a question of, if you've got a situation where 1 in 6 homes in the UK are potentially overcrowded, and you're trying to put state standards of 11 square meters supposedly for a bedroom, but most households not matching it, does it make sense to have that standard? Would it make sense to, for example, allow for smaller bedroom sizes, but allow for at least every child to have their own room in terms of the spacing as well? So not really answers, more questions at that point, but I thought just in terms of perspective. Just the last slide is to think through the case of, obviously, what does this mean for São Paulo? What does it mean for Brazil? How does this relate to that as well?
Thank you so much, Stuart. Let's proceed with our dynamic. So this round with a question. Then I will start with Lauren, okay? So we have just first a comment and then the question. So the comment is, during the pandemic, adaptation strategies culminated in transformations of the space in the most diverse scales and forms. We observed the virtual space becoming the classroom for children and youth. The street was enhanced as a meeting and leisure space in popular neighborhoods. Community gardens emerged as a strategy for income generation, food security, and mental health promotion. Cultural spaces such as community libraries were transformed into centers for the distribution of basic food baskets in the struggle against hunger. Sports courts made room for field hospitals for the treatment of the COVID-19. Among many other examples, and such transformations were experienced in a particular way by those social groups that have their right to decent housing denied and do not access adequate urban infrastructure, equipment, and public policies. In vulnerable territories, whose precarious situations is the result of an exclusionary economic system, the pandemic has shed light on the power, the responsibility, and most the load of youth and their communities as agents of change. So the question now, what does your research inform us about? On the one hand, how the pandemic brought lessons about other ways of living in big cities, and on the other hand, how the survivability of vulnerable people, vulnerable social groups continues to be dramatically threatened by urban crises in the face of the continuing advance of neoliberal capitalism. So, Lauren, please, the question.
How long do I have to answer to that? Probably, I'm going to come back to one of the points I made on my slide, the idea of reactive adaptability and proactive adaptability, and probably join it up with, the work I did on temporary urbanism. I think what we saw with the pandemic is essentially reactive actions in terms of really authorities deciding, as Leandro mentioned, to shift the use of buildings and spaces. A lot of this was really done on sort of reactive measures in order really to promote social distancing, etc. I think that's one thing. And in regard to this, actually, I would say we haven't learned much in regard to vulnerable communities, because really what happened when we're looking at the impact of the pandemic on the most vulnerable, there's a key correlation between deprived, poor quality built environment, and this goes beyond what Stuart was saying, the home, but it goes around the neighborhood. Because we know that vulnerabilities linked to urban inequalities in the sense that typically the vulnerable household live in very overcrowded settings, not only the home, but also the neighborhood. Often there are neighborhoods, and that's the case in the UK. It's similar very much if you're looking at US cities. You exactly have the same kind of challenges in Brazil, in South Africa. There's a lack of green spaces. There's a lack of places where people, and especially young people, for example, could play. And in regard to this, really what happened was, in many cities, not a lot of lessons learned around it. And here I'm going to bring the example of London and New York. So in London, the response towards really trying to create better spaces for people who have little access to parks, etc., was actually not much responses. What London did during the pandemic in relation to streets, in relation really to public spaces, were mainly try really to deal and to focus on mobility. So how, because there were less car traffic, to use the streets, for example, to promote cycling paths. The big legacy in London in regard essentially really to learning from the pandemic has been an acceleration of new cycling paths, which we can agree is a really great thing in terms of active travel, in terms of climate change, but dealing essentially with inequalities, this is not an answer at all. There's been no really discussion around trying to think about streets differently, promote more play streets, to allow really children to get out of their home and play safely in the street. Here, I'm going to bring in opposition the example of New York, because New York has been doing a lot of things which are quite interesting. They have promoted a scheme which was already there before the pandemic. It was called the Open Streets, which essentially allowed communities, business improvement districts to apply to close streets with a huge flexibility, and this relates to temporary urbanism because the street can be closed from, for example, say at 7 a.m. to 6 p.m. So it's not essentially a full closure, it's a closure depending on needs, depending on what the community wants. I'm not going to give a full assessment of the scheme, but going back to the point of vulnerable communities, what happened, and this is now becoming one of the most famous open streets in New York, it's in Queens. It's actually in the neighborhood called Corona, interestingly enough. It was in a neighborhood which was essentially one of the worst neighborhood in terms of COVID rates and COVID deaths. And this is now in one of this neighborhood, the most famous open streets because it covers at least 30 blocks. And this is now a street that is closed every day from 7 a.m. and 10 p.m. in an environment where there was barely essentially no green spaces. What happened here is the street became a place where the community could go outside safely, where children essentially after online schooling could go and play, and the parents were exhausted. They could just send essentially the children in the street. And some community members decided to organize, for example, races and things like this. So there's been some very interesting responses in some cities in regard really to tackling inequality in different ways. I think the problem here that we're seeing in many cities is there's been a push to going back to normal, to forget about the pandemic. And what you're saying in terms of the adaptability, there's been essentially very little lessons learned on how we can improve essentially the living conditions of especially those who are in settings where they don't have enough to essentially have a quality of life, a certain well-being, and essentially something, some criteria that are deeply impacting their mental well-being, their hope in the future, and all those kind of issues essentially that are related. So, I mean, I do have quite a negative, in a way, vision. So with regard to what is the situation currently, and this is really a call to try really to learn much more about what and where it went wrong during the pandemic, to be not only prepared essentially really for the next one, if there's one, hopefully not that soon, but especially really to deal with the everyday pressures and inequalities that the most vulnerable are facing.
Okay, that's great. Thank you. Abram?
Okay, thank you so much for that question, Leandro. I think from the South African, Zimbabwean, and Lesotho side, I'll just say in Southern Africa, what the pandemic really revealed were the underlying social justices that are currently there. And this was actually seen in multiple ways that the poor really suffered. So in the first instance, so like in Zimbabwe, the greater part of the population is employed informally. And there's been a lot of tensions between the local authorities in trying to address this informality. So on the 20th of March 2020, when the national lockdown was announced, the next morning, the government went by, the city councils went by, just demolishing all the places where these people were operating from, just using now the pandemic as an excuse to get rid of them. And they were like, no, after the pandemic, we are going to really make sure that we address we put you in a safer place, which has never happened to this day. Then another thing that has happened, public transportation also tends to be a very big issue. I don't know here, like we have got vans, I mean like the taxis?
Minibuses.
Yeah, the minibuses. Oh, like we have the minibuses that are mostly private owned, and this is where a greater chunk of the people operate in. So when the pandemic comes, so one can accommodate about 16 people, but when the pandemic came now, the government now just said no more minibuses, and then they brought buses, bigger ones, but they were not adequate now to address the public transportation issue. So there was a very, very big deficit, which even put people at crisis now. Like people had to be queuing for many hours to get onto the bus in and outside of the city. And when that thing was happening, no, there was no social distancing. And then they spend more time now to travel. And then it became a challenge now when they arrived home later. Soldiers were in these poor suburbs. And then if they find you, if you're outside, then you'll be actually victimized as well. So the other thing that then also happened is albeit the pandemic coming, there was also the distribution of the vaccine was also not even. And there's I think how I put it across, like there was this sanitation syndrome, which I think like the authorities just left these poor people, like let them just die like that. Because one thing that happened is there was a military camp which the soldiers, I mean the elites kind of put all the ventilators and the things that were required for the vaccine, so much so that they could actually access that, and then no one else could actually access those things. They never really made an effort to ensure that the public have access to these healthcare facilities. So it's that thing of really showing this thing of just the negligence of the poor, and then just leaving them to be on their own. And then if they die, like no one really cares.
Yeah, I mean, I could probably only speak from the South African side, not the government, etc. I think maybe one of the things the pandemic revealed, I think, is the lack of government's understanding of how people live their lives. I mean, one of the examples in South Africa, I think, maybe touching on the food schemes, was the main food intervention in South Africa was school meals. It was about 9 million children every day got a meal, 45 million meals a week, as an example. So COVID comes along, government closes the schools and closes the feeding schemes. And it was only then, like as an afterthought about, well, now what do we do? Now how do we get food to young people, etc. And there was always this question, I think, it's not so much about just the feeding schemes, it's a question of how does a government not realize that its main way it gets food to people is through schools? And if we close schools, now suddenly they don't have access to that. And now we've got to kind of scramble to it as well. So I think a little bit catching, because I think Armin's answered quite a decent amount for the South African side, etc. I think it was this question of just showing governments not thinking through things. And I think it was also on the South African side, it was looking at what the international community were doing, looking at lots, especially looking at the global north, saying, right, the global north is doing X, Y, Z. We've got to be the same as the rest of the world, trying to do global north strategies, applying it to a context where it just never would have worked, etc. And you can see from examples like the houses we're talking over there as well. Tell students to learn from home. Well, if you're living in a 15 square meter shack, how do you do that? And now suddenly you don't have the meal that you used to, so you can't even, you're hungry, you're in a 15 square meter shack, you can't learn, which was a terrible reality. But I think the bigger point was government somehow looking past really good data collection, years worth of knowing the situation and making really bad decisions based on that lack of knowledge.
Okay, let me come back to the stage. Now the second question and the third round of this panel. The comment. Different narratives and ways of conceiving the state and public policies were established during the pandemic. On the one hand, we observed a resumption of the debate on the welfare state and the guarantee of rights, presenting the defense of a universal and inclusive health system, for example, and the adoption of income distribution measures. On the other hand, the advance of a far-right and neoliberal political force was evidenced in negationist postures, in the discredit to science, in the adoption of a death policy. Just a comment inside the comment. as we are studying here and having the experience of changing ideas and studying and debating with young people from vulnerable communities here in Brazil, here in São Paulo, it's appearing also for us as they are the young people engaged here. They got upset in trying to protect their communities, but at the same time looking at the a policy of disinformation, right? That's something very important in our context, and I suppose in other countries too. Furthermore, the success in facing the pandemic and in containing the spread of the virus came about with the expansion of control and surveillance strategies by the state apparatus in the reduction of channels for popular participation and construction of policies. And the question, what do you have to say about the whole of the state in the planning of post-pandemic cities? What are the possible paths for an urban planning that preserves and guaranteeing the rights of children, youth, and communities in the urban vulnerability? Can we start with you, Stuart?
Sure.
Easy. Okay. Thank you.
Sure. What can the state do with urban planning of post-pandemic state? I mean, it's one hell of a question, etc. So I'll give my best, but I can't answer to be perfect, etc. I mean, I think at the one side with urban planning is often the state will try. So, like, if you look at the learning question as an example, in the South African case, I mean, maybe to come back to that question of things like homework as an example. The solution immediately from an urban planning perspective, we would say, I'm guilty of this as much as anyone, would be to say, well, how do we build homes that are better for young people to live in? What is the housing solution to that? How can we do housing better? The question is, that's not really responsive. And I mean, I think in the UK, to give the example, I think they say 80% of the buildings that people are going to live in are already built, as an example. So to some extent, I think with the post-pandemic state, it's seeing those connections and starting to say, well, if we can't change cities, do we change how we live in cities, for example? So things like learning and schools are more malleable spaces. So the question is, do we look at that in terms of what we can change? On the South Africa, I mean, it gets also tricky down to resources question as well. I mean, in South Africa, the question when it comes to things of housing is the answer is the government's done too much and it almost needs to be going back towards doing services. So in the post-pandemic state situation, it's a tricky one as well. Yeah, I'm almost cautious a little bit about saying on the UK side, etc. But I mean, I think on the UK side, I think what my presentation was kind of trying to get to was, what do we emphasize? What do we prioritize? Do we need to look at the standards so that, okay, if 80% of the homes that already exist are already there, we can't change those, but for the 20% that we will still build, as an example, how can we at least do those better? And realizing that we can't have our cake and eat it. We can't necessarily have a 79-meter structure plus extra bedrooms plus all of these things. So it's a question of realizing, right, what is the most important thing from a house, and saying, do we have regulations that focus on that? My impression on the UK side has been a little bit of trying to do everything and starting to say, well, that's not possible, then what's the most important? I don't think we were there yet in that conversation as well.
Thank you so much for that. I think what I would say from the Southern African perspective, I think the state was clueless on what had to be done. But I think to some extent also, I think when the pandemic started, I think there were some sentiments that more people are going to die in Africa, especially sub-Saharan Africa, than anywhere in the world. But surprisingly, besides South Africa, the mortality rate was not so much high. And then I think this is where also the positive side of the issue can come through. Because one thing that we also found is that the governments were very proactive, and this was maybe mostly due to the history of pandemic pandemics that has happened in Africa, which I think in the other context it has not been there. I'll give an example. Like I think in the past 2 decades, we have had 2 or 3 Ebola outbreaks. And this with Ebola, I remember back in the mid-90s where the Zimbabwe national team had to go and play soccer in Zaire, then Zaire, now the Democratic Republic of Congo. They were bad, like they played in an empty stadium, and we were hearing that if you just get contact with someone's sweat, then you die and all those things. So when the pandemic came now, it was easier for most of people to relate with it because this is something that had been happening before, and most governments to some extent were all prepared for it. Then another thing that also has happened is like there have been multiple cholera outbreaks that also requires a certain level of hygiene for you not to actually. So I think for me, in as much as we talk of this misgovernance and all those things, I think the government to some extent, they knew what to do in terms of ameliorating the spread of the pandemic. Then another thing that we can actually say is that for me, I think what Stuart has indicated, the challenge was there was more of a bottom-up approach, which was even coming from like your World Health Organization, which was imposing restrictions to all the nations, and people had to conform. So to some extent, like if you had to get some funding from the WHO, you then had to do certain kind of things. So I think that's where, to some extent, these disparities actually came in terms of how the government appeared to be a bit clueless. Then another thing that we actually saw, which may also maybe be due to the top-down nature that came from the World Health Organization, was that there was little consultation which the government did with the ordinary person. And due to this now, people felt as if the government was imposing stuff on them. And then when you are actually just told that stay at home, don't even go outside of your home, you don't even know what the virus is, what the pandemic is, then you're asking, but why? I'm not even sick and all those things. Why should I be staying indoors? So there was a little, the government maybe didn't do enough to really educate the people, informal education and citizen awareness as well. So looking at it from a planning perspective, I think what could be done much better is, I think, moving more towards participatory approaches of planning, where everyone is actually engaged in, from the young people, from a gender perspective, and even the disabled, so much so that whatever comes out of it is actually inclusive of what everyone really appreciates and can relate with. Then another thing that I actually saw with the pandemic that I'm still grappling with to this day is the healthy institutions were overwhelmed. And then we had some facilities that I would say are not really used. Like you have got a stadium that is only, maybe an arena that is only used for a match on Saturday and Sunday. And then if you look at most of them, like those that watch soccer, the arenas that were built in Qatar, some of them are like hotels, some of them are like they are well advanced. So why can't we start thinking of having multi-purpose public spaces that can easily be converted to some of these things? Like if you've got a stadium that won't need much retrofitting, it can then be used for such purposes. Then when we look at schools, the major thing that was there was that the social distancing, then it made it difficult for people, for students to be learning in there. So if you can start looking at having at a community level, multi-purpose infrastructure, I think with the one that we went yesterday, which they said the ballet, then they came there, they started doing their stuff there. So if we have got more of those things, I think it will be very useful as well. I think just the last one. Because what then happened, like in South Africa, I think, which is also like what happened also in the world, is there was a lot of money that was wasted, which literally went down the drain. Because when we heard of COVID-19 is coming, people anticipated that people are going to be dying, people are going to be infected. Then they started a mass construction of emergency facilities, and it never happened like that. And just a lot of money just went the drain because most of these things were not really used at the end of the day.
I'm going to follow up on what Stuart and Abraham were saying, but I think probably I want to start by, if we're looking at the pandemic, if we're looking at the responses that spread across the globe. So we had the WHO guidance, and really when you're looking across, there's been a discourse around global interest. We had to fight the pandemic. And I think through this, there was a sort of assumption that this was supposed to be inclusive. However, when we're looking at it, it was actually highly exclusive, because when you're looking at who were protected, there was to some extent, essentially, there was a certain right to be protected. And I think we're really starting to seeing this with our PANEX research, is a lot of people actually were not perceived as having the right to be protected. They were not essentially in positions to be part of getting this protection against the virus. And here we're really putting all the vulnerables as out of this protection. And I think that's really something we need to keep in mind, is this policy, which was supposed to be for everyone, was actually not for everyone. It was for those, for most of the case, who had certain incomes. It was for those who were living in certain areas, but you were essentially in or you were out. The other thing as well, which I think is really important, is, and this was clear if you looked at what happened in England, in the UK, what happened in France, it was not only a protection of the people, it was a protection of the health system. But we need to contextualize this in the context for the past 2 decades of health systems that have been basically completely disinvested. So in England, we protected the NHS, but we need to recall that the NHS essentially was under-resourced. Similarly in France, and now the NHS, the health system in France, are going under massive, essentially, pressures because they need to recover. So we were protecting people, but we are especially also protecting a health system in a way. And I think that's a problem because it is highly exclusive, essentially. So there's been some key decisions made by the state with regard to really who could be protected. And I think in this, on top, we had also a clear selection with regard to who essentially had to be protected. And in relation to this, there was essentially an age decision, and we go back here to children and young people that were perceived as not vulnerable to the virus. This is something we're flagging up very clearly in the report that is coming very shortly of our PANEX research. They were considered as not at risk. And because they were not at risk, they didn't really matter. So they were not at the top of the priority with regard to their other rights and their other needs. So I think we need really to remember this, how exclusive essentially those policies were, without and hidden essentially within the protest of protecting everyone. From a planning perspective, I think this resonates greatly with the wider concept of the public interest or the public good. So this is something which is at the core of the planning profession. There's a lot of theories around the public interest. And I think we tend to assume that the public interest is a large notion that can be applied essentially across all types of action on the urban. I think we know, and this goes back to what Stuart and Abraham are saying, that essentially what is important in planning is to recognize the diversity of places, to recognize place-based approaches, bottom-up approaches, participatory approaches. And in relation to this, and again, this connects to some of the work we did in South Africa a couple of years ago, we should actually really talk about fragmented public interest. The public interest cannot actually be the same for everyone. It needs to account diversity. It needs to account for urban inequalities. And essentially, it needs to be fragmented because it needs to be very much targeted with regard to where it needs to be applied. And I think that's really a key lesson that we can draw from the pandemic, but essentially really from the failures, often in many cities, from really addressing urban inequalities now for decades. I think there's another issue as well when we're looking at state responses and essentially the directions that are currently taken with regards to how we're dealing with key urban social economic issues, is the fact that, and this was very visible in the UK, the priority was protection, but actually it was the protection of some people, but also it was especially the protection of the economy. Going back to adaptability, there's been some efforts to, in some places, to try to accommodate and create more places to play. The key effort in adaptability beyond transport and mobility was to try essentially to promote local economic development. The first thing that happened in the UK was to try to reopen restaurants, reopen pubs, because of course pubs are just crucial. I mean, young people needs less crucial, but reopening pubs was crucial. And this essentially was really driven by a key economic development narrative. There was key political decisions that were made essentially in regard to adaptability and in regard to how really cities had to move forward. And I think this economic narrative essentially needs to be broken, it needs to be unwrapped, unpacked. And it's not a matter of saying that we can't think and we need to deny it. That's not what I'm thinking. But I'm thinking that we really need to think about economic development, economic recovery in a much more systemic and inclusive way, where essentially social inequalities and all the other range of problems and health problems really need to be integrated to this. I think we need to really recall how the pandemic occurred in a context of ongoing cuts and pressures. If you're looking at the UK, we've been in a context of austerity for decades, which meant that local authorities were undercut, which meant that a lot of charities, community groups, etc., for example, the play sector went under significant cuts before the pandemic. So essentially, there was already very little resources before, and the problem is going forward, essentially, there's not much done. Again, we're still in this context of cuts, in this context that everyone needs to be making efforts. However, we are in a context of a cost of living crisis with huge pressures for everyone, and especially towards the most vulnerable. Before just zooming in to young people, I want to say one more thing around adaptability. And this connects again to what Stuart and Abraham were saying. I think in regard to adaptability from a planning perspective, we don't know how to plan in an adaptable way. We are basically anchored in a very rigid planning system where we have specific land uses. We need to tick all the boxes in terms of health and safety. We need to ensure we're doing things by the rules. However, when we're looking at cities, even in the UK, but more importantly in South Africa, for example, or in Brazil, the cities and most of the neighborhoods are actually functioning because they are functioning in a non-planned way. So they're functioning because things are happening organically, they're happening incrementally. And we as planners really need to recognize this and find a way really to promote adaptable planning, because this is really how in the future places, crises, and communities can cope in regard really to crisis similar to the pandemic, but also to what will happen with climate change. And in relation to this, and this goes back to the rhythm, and for me this is much beyond the temporariness. It's essentially also disconnecting the planning from the political side of planning, because planning, as everything at national and local level, is also tied to political agenda, of course. And the problem in relation to this is always going back to what can be done within the time frame of political agenda. And as we know, this has significant issues for planning. And planners essentially, they navigate amongst this, but sometimes they lack resources, sometimes they lack power. So we can't also just put all the fault on planning, because most of the time planners are really trying to do for the greater good, but they have essentially, and they need to navigate within a very complex and difficult environment where there's huge, essentially, tensions between power relationship and really who has the power, but also who has the money really to make the decisions. And in regard to young people, and as I said from the start, those were very much the forgotten. Those who essentially were completely ignored during the pandemic. This is something we're seeing across the 3 countries in our PANEX project. What we need to really think of moving forward is the long-term legacy of the pandemic on them. And there's really a lot of things here that needs to be considered for planning and much beyond. We need to think about their education. Stuart picked up on this a lot. There's going to be a lot of impact with regard to career trajectories and what is going to happen next. This is going to have some impact on employment, on essentially expectations on life. This needs to be at the core of the agenda. The fact that their right to play, to have leisure, was denied during the pandemic, and we started seeing this when we were talking with young people in the field. This had massive impact on them, on their mental well-being, on their feeling of isolation, on being happy, having hope for the future, and just being confident. This, again, needs very much to be at the top of the priorities. And also we need to think about mobility. What the pandemic did, it put some people really in a sort of very little island. They made them feel very isolated. But we need to remember that there's a correlation between career progressions, between essentially the aspiration of doing something else with essentially your ability just to get out of your neighborhood, but also to be able to go out of your neighborhood, not only financially, but also psychologically. And I think those are the kind of issues really that needs to be integrated. And even though they go much beyond planning, they do resonate with how us as planners, we're essentially really thinking about cities for the future.
Okay, thank you. That's great. Now, Gabriela, your comments and debates are very welcome.
Okay, thank you so much, Leandro, for inviting me. It's a great pleasure to be here and listen to Abraham, Lauren, and Stuart. And thanks for sharing some experiences, reflections, and provoke us to thinking about the role of the COVID-19 in number planning, in considering or not how vulnerable people react or cope with the pandemic. But more than this, to provoke us to think the lessons that we could learn or we should learn from this crisis. So I have some comments or perhaps some questions. I'm not sure if you have time to respond it, but at least I think that we can thinking about some questions. The first one is more connected to the role of the cities in adapting to crisis. So personally, my own research is focused on how cities, particularly in Brazil, are responding to climate change to integrate adaptation to the agenda. And we think that if you're thinking about different dimensions and indicators and variables that are critical in terms of how local governments are responding to climate change, there are at least 5 critical aspects. We say, first of all, the perceptions, if local governments, practitioners are perceiving the risks of climate change, if they are warned about the negative impacts. The second are resources in terms of information, scientific knowledge, but also human resources, technological, financial. The third aspect is the administrative practice, the routines that the local government have to deal with in the daily of the administration. The fourth dimension is the political interests. If the politicians, decision makers think that climate adaptation, for example, is important in terms of agenda, in terms of actions, and the last one is dynamics of urban planning. And I was thinking that if we can thinking about the same aspects considering the pandemic of COVID-19. In our research, it was very clear that political interests are very important in terms of the responses that we have or not in the cities, but also the dynamics of urban planning, particularly when we're thinking about the specific groups that pressure the city, that make a kind of lobby to get their interests in terms of the regulations, in terms of the urban design, the urban plan, and they decide what is good for the cities. So can we see the same things, the similar aspects in terms of COVID-19? The second thing that I would like to bring to our conversation today, it's about communication. I think that one critical aspect in terms of the pandemic was communication, how people receive information about the COVID-19, about a virus that we didn't know at that time in terms of contagious, in terms of negative impacts on our health. And we have lots of, at least in Brazil, spread of misinformation or fake news. And this kind of information circulate on social media and the people, but also by the politicians, by the federal government that spread confusion, that spread misinformation. And I was thinking that what is the role of the communication in terms of the reactions that we have in the COVID-19 in your reality, in your experience, but particular with the young people, because I guess, but I'm not sure if I'm right, that the young people are very resistant in get information from media, mass media in general, and they are very open to social media, to fake news, and also we have problems with education during the pandemic because most of the schools were closed. So what is the role of the communication in terms of perceptions, but also actions and reactions to COVID-19? The third aspect that I'd like to provoke us to thinking about is the awareness about the neglect of many aspects that are critical in terms of crisis in general, but specifically in terms of COVID-19, and about the conditions of vulnerability, about inequalities, the lack of surveillance strategy, the lack of facilities, infrastructure. So my question is, we as scientists and researchers are very aware about the role of these neglects in terms of responses and reactions and consequences of COVID-19. But people in general now are aware about this. We, as researchers who are studying these things, what is our role in terms of clarify these neglects, these actions, omissions, and obstructions that make the conditions of vulnerability much more worse? We are okay in terms of giving visibility to this neglect to the public in general. And the last one, it's in terms about the perceptions. I have a student, Yun is here, my PhD student, and she's very interesting to investigate how young people connect the COVID-19 crisis with other crises that you have to deal with, like climate change, but also the loss of biodiversity, the food insecurity, unemployment crisis, but also crisis of responsibility, crisis, political crisis. So young people are connecting this crisis and how they deal with these systemic risks that interact and have cumulative and synergic effects. So what would you have to share with us about these connections? Many questions, Leandro, again.
That's great.
Thank you so much. And please choose what you want to respond, because I know that we don't have enough time to this.
Thank you so much for your comments. We still have a little more time. I think you are very provocative. It's nice. I know you because we work a lot together. So, we are going through this research for one more year or even more. But maybe these questions help us to work more 5 years, maybe. Anyway, besides this comments, I would just I would like to read one question that we received, and then we can share the time for answers and comments to finish the panel. Okay. So we received a question from Francisco Ribeiro. So the question is, can the introduction of health street concept helps vulnerable communities? I don't know if all of you know this concept, health streets or healthy street, because it was maybe healthy street. Okay. Who would like to start the comment? Laurie? Okay.
I can start quickly. I'm not going to answer to all of this because we need to leave space. I think on the communication, there's probably more to say on the South African side, so I'm going to leave this aside. I think on lobbyism and really who has power, I think it goes back to wider question in planning. When you're thinking about cities and urban development, I mean, it goes back to power. And the COVID was very similar to how cities are and sort of developed in general. I mean, they are in the hand of a very powerful group. As you know, in the UK especially, we are within public-private partnerships, and the design essentially of new developments, the way essentially the cities are transformed, this is highly influenced by essentially key financialized agenda. So I think the issue of financialization as a whole of the city is also linked to how the pandemic essentially was approached to some extent with clearly, essentially, and it goes back to what I was saying, I mean, really priorities. And essentially, it was highly exclusive, really, in that aspect. So I think clearly in relation to this, I mean, really, it wasn't inclusive of the needs of all. In relation really to, I mean, the political dimension and the neglect, I think what is quite clear is when you're looking across, most of the COVID-19 related policy were policies essentially of neglection, because what was ignored essentially were those who were essentially living in the most vulnerable conditions, and those who didn't really have the voices to be heard. I think the problem we're having, and here in a way, when we're looking at South Africa, England, and Brazil, is an issue around what is visible and not invisible. When you're looking at the pictures that Abraham showed, I mean, poverty, key economic and social economic inequalities are just completely visible. When you're looking at countries like England, I mean, those issues are much less visible. So they're much less essentially at the forefront. A lot of them, if you're informed, if you're essentially critical enough, you know what's happening. But actually, a lot of those struggles that young people or vulnerable households essentially go through, they remain actually quite invisible. And I think that's the problem, and that's really our role as researchers, is to make essentially really this highly visible. Healthy street. Okay, I'm just going to say a few words on this. This is a concept which, I mean, in England especially, they try to promote this. I think this is something which is probably at the starting point. We had a lot of new development which were really built around healthy city principles that are supposed really to promote physical exercise, etc. I mean, at that stage, we don't really have key example of very successful approaches. And that goes back in a way to my point on the first, is the way new urban development are led in the UK are based on public-private partnership, and essentially there's quite a lack of control with regard to what's happening once essentially the master plan is agreed. And often, and here especially in terms of design, I mean, the work of Matthew Carmona here is really exemplary to just demonstrate the failure of urban design in most of the new urban development in the UK, especially in regard to really well-being, livability, healthy environment, because essentially what is prioritized is just you have a home, you can park your car, and that's it, and we move on. And us as developers, we're just here essentially to make money. I mean, I simplify, but essentially that's an issue, and that's a real issue when we're looking at the UK. And I think this is really exemplary when we're thinking about Stuart's first picture with regard to the types of social housing we have in the UK.
Okay, thank you so much. Yeah, I think I'll just touch on 2 points. The first one that relates to your work on climate change, which is about the perceptions. I think the major issue that happened when the pandemic started, when people were asked to stay indoors, there's a study that we undertook where people were like, I'm just going to die either way. If I stay indoors, I'm going to die of hunger, because these people could not store food that can last for more than a week. So if they are now, and their economic activities had been cut off now, and some of them live in places where they don't have pantries, they don't have fridges, they can't stock food that can sustain them for maybe a month. So they actually constantly had to go out. But then going out now to get their sustenance, they were exposing themselves to the pandemic as well. So they say either way, if I don't die of COVID-19, I'm going to die of hunger. So yeah, that's the kind of perception that they ended up having as well. Then regarding the aspect of communication, I think in any crisis, communication is very, very critical. And communication also comes with an aspect of trust. And I think if we reflect on the Hurricane Katrina that happened in New Orleans in the USA, the Black community and the Iskapians, they had that antagonistic relationship with the authorities. And then when the early warning signs came through, no one took heed of. Like, these people, they are always like, how can they be nice to us all of a sudden? If we literally put it that way, why are they warning us of being of a danger that's coming through? And that's how most of them got to be affected by this. But the early warning signs actually came through. So there are two dimensions to the communication from the Southern African perspective. The government really communicated that there is a pandemic that's going to come, and then things are going to be nasty. People might die if you are not careful. But then people were like, why should we be listening to you? Why do you care about us? And then in South Africa, I think to some point now, when the rate of infection started going up, the mortality rate was very low. Like people get infected with COVID-19, but then they don't die. So then they were like, okay, it's just like a flu, then why should we be so much concerned about it? But some studies now have shown that the effects now stay with you for quite longer. And then it was this kind of miscommunication that was actually there. Then in one of the research that we also conducted, it was mostly looking at knowledge and perceptions and communication. It was surprising that the communities, they trusted more of the nurses and the doctors than they did of the government communication. Because one gentleman remarked that these people are trained to do science. And then the politicians, they know nothing besides just getting money and being in power. So we would rather listen to these people that are being led by science. So you actually also see that there is that element of giving respect to those people that are the frontline workers to some extent. They were really appreciated as well. Then the person that asked the issue of the healthy streets, what I put in here is maybe I'll frame it around the 15-minute city, where everything is just within close proximity. And then from what we actually saw from the Southern African perspective is that the pandemic got worse the further you were from critical services. So if that design comes into effect where it's a walkable city, the spaza shops are closer by the groceries and everything, then it limits that distance that you can go and then interact with the outside. And then it also talks about instead of using vehicular mode of transportation, it's mostly a walking or a cycling thing. And then with COVID-19, you actually saw that there were some people that then moved away from moving with the buses and started using private cars or cycling and all those things. So I think to some extent, this could also help as well, as it limits the interaction and then frees. Yeah.
I mean, I think coming back to your original question in terms of COVID-19 and then that kind of relation to other crises, it's certainly not true just of South Africa, and it's possibly lesser true of the UK, but I think South African cities are used to being in a constant state of crisis, and they're used to being in a constant state of multiple crises, etc. as well. It then starts to raise questions about, and I think Abram was touching quite well on this, in terms of who gets to state what is the most important crisis as well. There's an issue with urban planning, especially in South Africa, where it gets used as the window dressing, because the state wants to look like it's good, wants to look like it's addressing every issues, often without changing what it's actually doing. So I think from the urban planning side, and I think I'm going to bring my UK South Africa perspective on this one. So in South Africa, when the fall of apartheid in 1994, there was a reworking of the planning system. And one thing that's been every 5 years, a municipality comes out with a new integrated development plan, which is a forward planning document, and every year they review the document, etc. And it's this crystal document that says, this is what we're doing, look at us, look how we're responding to all these different crises, etc. There are also then other planning documents attached with that as well. And it's almost become a thing of, within those documents, it's recognizing we need to look like we're addressing this issue, addressing this issue, addressing these issues. And there's a lot of words put to that. But then there's the bureaucratic apparatus that basically says we don't actually want to change. We want to keep doing things like we've always done them as well. And almost urban planning gets used as a way especially the plans that get produced, get used as a way to look like we're doing the right thing, but we're not actually as well. And I think sometimes even like with COVID-19, with climate change, etc., a lot of these documents will come in. And I mean, one of the biggest places I saw it back in South Africa, and I think one of my biggest frustrations was I originally started working in development control, and you would get a new development, and you would look at the policy, and you would assess it according to this policy document, and you get to the committee, and the committee would say, "No, we're fine with it," etc. So I think it is this question of South African cities are constantly in crises, and there's almost been this way to look good. I think COVID-19 has probably just been fitted within this existing apparatus of trying to work around which crisis is actually most important, how do we look good without changing our actual practice as well. Less so in the UK, and I think this was the interesting side, is the UK is far worse than South Africa, weirdly, in terms of coming up with new plans, coming up with new documents. Most UK municipalities, the documents are far more outdated than most of the South African ones I used to work with, which I found slightly ironic, etc. But I do think it's still not great, but I think the UK does tend to take a little bit more of a serious line. So when it looks at things like climate change, when it looks at things like net zero, there is usually more effort made. So when someone does a planning application, as an example, that you actually look at the issues to some extent as well. I'm not quite sure if I've seen a COVID-19 urban planning response in the UK. And I think a lot of the planning changes are almost gotten before COVID-19 had basically kind of hit the store. So I'm not sure if we've actually seen much change in urban planning in the UK in response to COVID. So to some extent, I think maybe in the UK, there isn't as much of a connection because it's hit the UK at this period of almost political hiatus where we're not really changing trajectory from pre-pandemic, etc. as well. So, yeah.
Okay, and I would like to ask if we have any question or comment from the in-person audience. Anyone? Any additional comments or questions? So, okay, thank you very much, all of you. We are going to stop for 10 minutes for a coffee break, and then we will be back with Luciana for the second panel. Okay, thank you for a while.
Also, hi everyone. We are going back to the seminar for the second panel. I'm Luciana Bisotto. I'm a postdoctoral researcher here at the School of Public Health from the University of São Paulo. And I'm also part of the project, the PANEX-YOUTH project, that is, well, the base of everything we're discussing here today, in a way. Well, the second panel has the following title, Interdisciplinary Research on the Health and Well-Being of Vulnerable Children and Communities in Post-Pandemic Cities. And we'll have two teachers that will make presentations. They are Suzanne Borne, an assistant professor in human geography at the School of Geography, Earth, and Environmental Sciences of the University of Birmingham. Her research focuses on youth everyday agency, emotions, and urban well-being in the context of interconnected urban crises. And her Marie Curie Global Fellowship was to explore how young people in Brazil can live better with and develop long-term emotional resilience in context of resource scarcity and disaster risk. Suzanne also has an interest in applied and impact-oriented research to identify pathways for integrating youth knowledge into public policies for a sustainable and healthy urban development. Thank you, Suzanne, for being with us. Well, Professor Peter Kraftel is also here with us. He's a professor in the School of Geography, Earth, and Environmental Sciences in the University of Birmingham. He holds a chair in human geography and is known for his research on children's geographies, and especially for research into the emotions, affects, materialities, and practices that make up their everyday lives. He publishes on geographies of education and architecture, and is currently an editor of the journal Area and Children's Geographies, and was a founding member of the Geographies of Children, Youth, and Families Research Group of the Royal Geographical Society. Thank you, Peter, for being with us as well. And Professor Marcos Bucherich, he's here with us as a debater of this panel session. He is an associate professor at the Department of Botany of the University of São Paulo here in Brazil, and the director of the National Institute of Science and Technology of Bioethanol. In 2010, he was appointed as a lead author for the Intergovernmental Panel of Climate Change report released in 2014. He is the actual president of the Academy of Science of the state of São Paulo and is a member of the Institute of Advanced Studies of the University of São Paulo that is also hosting our seminar here today, and is a member of the research group on environmental studies, and also the actual coordinator of the IEA-USP Global Cities Program. So thank you, Marcos, for being here with us. Well, we are following the same structure of the first panel. The two professors will have 5 minutes to make some introduction presentation, and then we'll follow with 2 rounds of questions that I'm going to make, and then some comments from Marcos. Okay, so the floor is yours. I don't know, Suzanne, do you want to start? Okay, thank you.
Yes, hi everyone. Thanks for being here. I'm really excited to be here. Also, I want to say I've been studying my postdoc for 2 years at USP with Leandro. So it's always a pleasure to be back and to be able to talk actually about my project. And I think it's quite nice to be on the second panel, like after we heard so much already about also the struggles during COVID, and also linking this to young people's everyday experiences. And actually I want to talk a bit about also my personal experience on the one hand, researching during the pandemic with young people in Franco da Rocha, which is north of São Paulo city. It's half an hour from here towards Jundiaí. And I think it's really important to remember that, like, when we want to work on these interconnected crises, and actually doing this during a crisis, it creates a lot of challenges, but also opportunities. And I think in the beginning, when I designed my research project, and Luciana already mentioned that it was about like young people's everyday experiences with disaster risk and access to food, water, and energy, and the everyday agency, because we really wanted to come from a perspective of young people also as agents, not only as passive victims, and like get a bit away from this position of young people living with scarcity, but also to understand how they can actually live better with the conditions they're kind of already living in, and also to understand the adaptive mechanisms that they have in their everyday lives. And our idea was to understand young people as co-producers of knowledge, to not come in with a top-down perspective, but really kind of take young people's experience and together with them kind of design the research proposal. Obviously, we have the constraints of being funded. So the project was funded by the European Commission. Obviously, they expect also kind of proposal in the beginning, but still we wanted to give it a lot of freedom to kind of shape with the young people the topics they wanted to discuss, and also using participatory methods, which is a very big strategic priority here at USP as well. But then the project started in 2019 in August, and I came to Brazil in October 2019. So as you all know, when you work with local communities and doing participatory research, it takes a lot of trust building to actually engage with people, which is like the basis. And I think we can't say it often enough, like how important the relationships are for actually researching the topics we want to discuss. And I think it's not only about researching on well-being, but it also is so influenced by the well-being of communities at the time, but also our position as researchers. So I came to São Paulo in October. I had really good first contact with the civil defense of Franco da Rocha and the CRAS, which are like social institutions from the government to kind of support families in need. And they had also weekly groups for young people to kind of engage and discuss topics also related to sustainability. And they were very open to engage with us and integrate our research into the yearly planning, having like weekly meetings with the young people aged 11 to 18 to discuss about their access to food, water, energy, but also their experience with disaster, which is not only acute in rainy season, but kind of has become a chronic problem, which is very seasonal, happens again and again. There have been huge disasters linked to flooding and landslides in Franco da Rocha multiple times, in 86, in 2011, 2016, and again more recently, even last year. And it's something that just is very present in people's everyday lives. When we think about everyday agency, it's also like trying to uncover things that are hidden. So that was kind of the idea, to kind of work on these hidden aspects of their lives to make them more visible and kind of really engage with young people's everyday. But it also meant actually being present, I thought, in the everyday, and kind of accompany them like in the everyday spaces. And also as a researcher from being based in the UK, I'm German, so I didn't really have any background in kind of their experiences. Obviously, didn't really understand what their flooding experience would mean, or even rainy experience in São Paulo. So different thing. People said, "Oh, I'm staying home because it rains." I'm like, "Why would you do that?" Until I lived here and then understood why you couldn't go out. But then with COVID, we were faced with this challenge of having like 2 workshops and then lockdowns, and nobody was prepared. We talked about this in the first presentation already. And I think also for us as researchers, not really being prepared to deal with like alternatives. In the project, we talked a lot about digital divide, which is a big key challenge for young people living in the communities, of access to phones, to stable internet, actually data packages where they could share data, maybe having one phone for the whole family. And also the Kreis itself as the social organization, they were really understaffed, overwhelmed. They didn't have any working like laptops or phones to kind of engage with us. So like when we think also well-being and COVID and young people, I think from a very practical perspective, I think this overwhelm also of the staff, the young people, of myself was quite present in the beginning. And finding a way around was kind of not a very linear way. I think it was like ups and downs. We suspended the project for a while, then we restarted. But actually, in the end, we also kind of thought about like, should we consider this a failure or a plan B? Is a plan B worse than a plan A? And I think, especially when we want to think about like participatory methods, a big challenge was how to translate this into another setting. So one thing we really found, which was really useful here, was like WhatsApp as the main means of communication, which was already very present in the community across young people, and which facilitated our research. So we then kind of were able to set up different groups and engage with young people over WhatsApp on a weekly basis over a period of 6 months. But after a break of like 10 months, the time it took to kind of everyone to kind of set up. So I think just thinking, I'm short of time, so I might have to come back in the discussion. It's just too much to talk about, but I think what we really realized was that when we think participatory methods in a different way, and we had to turn it upside down and see ourselves maybe a bit in a teacher role with participants, but kind of even facilitating different forms of expression that we didn't think about, and kind of giving ownership to young people, first of all, by choosing devices they wanted to work with, but also giving them the choice of how they wanted to express themselves, maybe not as creatively as we thought with theater or videos, maybe just by text messages, but also engaging with them in topics they really cared about, also beyond what we initially thought. Maybe they wanted to talk more about like garbage in the community. Kind of giving them the ownership really meant like putting them in a place also to kind of engage with us from that perspective of, you know, being experts, and we kind of learning together with them. And I think also engaging with topics we maybe found hard in the beginning, like how do you talk about food insecurity while you are in a situation of food insecurity in the middle of a pandemic. I think now when we have like the PANEX-YOUTH project, for example, looking back, I think it's a different reflection, like looking back. But I think once you're in it, it's really hard to kind of also balance what do you talk about, where do you put the limits. But I still, nevertheless, I think despite kind of some struggles to engage, maybe being careful not to, you know, surpass like ethical boundaries and kind of be protective of people's well-being. I think it was a very rich project, and I think it really gave us also the scope to kind of explore the technical aspects maybe of what we call like the food, water, energy nexus. But I think what really stood out was the importance of emotions and young people's kind of way of coping or relating to the everyday situations, something I would like to explore more in the future, because I think often young people had a tendency to normalize disasters and the situations they lived with, and kind of engage with a sense of humor and making jokes. And even though we wanted to come from precarity to hope and not really stay in something that's, oh, everything is difficult, and, you know, kind of feel a bit like this despair, what can we do? And I think young people kind of really were very appreciative of their own realities, and kind of really also showed us how to really appreciate where they live and things in the neighborhood they really enjoyed. I think it was really important to think about strategies for the future, how we can engage more openly with the emotions, which was really hard to do online. So I guess maybe going back to person is really important. And like this week, and people talked a lot about like well-being and how they were feeling in the pandemics. So I think for me, it's the next step. We should think about strategies on how to integrate it now to research, but also integrate this into public policies. So yeah, I would just end here and hopefully expand a bit more in the discussion. Thank you.
Thanks very much, Luciana, Leandro, and to everybody who's organised this afternoon's event. It's fantastic to be here. So just a little bit of context, further context about my work, first of all. With colleagues, I've been researching children and young people's everyday lives and participation in urban places for the last 20 years. Much, in fact, virtually all of this research has been interdisciplinary. In fact, I see myself not only as a geographer, but as an interdisciplinary scholar of childhood and youth. And this is because, as I'll note in a moment, and as the conversation at the end of the last session highlighted, the challenges facing children and young people are multiple, compound, and complex. So in the past 20 years, I've worked with engineers of different flavors, with ecologists, environmental nanoscientists, social media experts, anthropologists, sociologists, education studies scholars, architects, urban planners, public health scholars, and many more besides. In addition, our research has been international in scope, and we're really proud to say that we have now nearly 10 years of collaborative research with Brazilian colleagues here at USP, but also at UNESCO, as well as research partnerships in Canada, India, Sweden, and Australia. And as such, I should say it's also wonderful to be back here at USP. The last time was 2018, and I was due to come here in May 2020, and we know what happened just before that. So what I wanted to do was just to offer a few opening points for discussion, which are kind of big questions that I've been mulling over in my research, particularly recently, but also for some time. And these are also provocations. They perhaps cut against the grain of some of the ways in which we often think about research with young people. The first question is, how do we position and frame children and young people, their voice and agency in respect of health, well-being, and their broader everyday lives in cities? All too often, they're seen as purely vulnerable and experiencing multiple challenges. And of course, children and young people are vulnerable, or many are, in different ways, and we shouldn't ignore that. But the response, often underpinned by children's rights, is to examine their spatial agency, what they think, what they know, what they say, what they do, whether in terms of the experiences of those challenges, or in terms of the solutions they propose, or, as in our PANEX-YOUTH project, the everyday adaptations in which they're engaged. However, although these rights-based approaches are important for vulnerable children and young people whose experiences are often marginalized, I think we also need to be a little bit careful. And here I would, and I have for many years, push for multiple forms of relational thinking. Firstly, that the notion of rights, however helpful, is tied to a more Western neoliberal notion of the individuated human subject, who is also responsible for their own lives. But what about the many relational, multi-generational, intragenerational, caring, family, and kinship practices in which children and young people are engaged? Children and young people, like all of us, are interdependent, not only independent. So for a whole variety of reasons, we need to question and perhaps move away from Western and specifically white, middle-class, neoliberal notions of subjecthood. Otherwise, we ignore so much of how children and young people experience and seek to adapt in their everyday lives. And we can push this further, as I've sought to do for many years, through what are known as new materialist and feminist new materialist understandings of children and young people's embodiment and of the material environments in which they live their lives. Much of my work has sought to explore, in an interdisciplinary sense, the ways in which human lives are interwoven with those of material stuff like plastics, like environmental processes and resources, and different forms of environmental change. This also means paying attention to how the built environment itself interconnects with social practices and relations, what geographers call spatiality, the coming together of the social and the spatial. And thirdly, there's also an issue of scale. That is, much research with children and young people tends to focus on the very small scale. Indeed, it assumes, perhaps wrongly, that children and young people only live their lives at the small scale of the household or the local community. And so for some time, geographers in particular have asked, how do we upscale that research? How do we demonstrate that children and young people and here we might think of those who engage in environmental activism or protest, are also active at a scale beyond the local. It's not only adults who have that privilege. So I thought it might be useful to just end my opening points with two conceptual / methodological examples, about which I may say more in the discussion in a moment, from two recent research projects, one working with colleagues here in Brazil, the other from the UK. And I think each offers starting points for how we might do interdisciplinary studies of the complexity of children and young people's health in post-pandemic cities, although both projects actually predated COVID. So the first project, which was undertaken in collaboration with engineers and educators at UNESP, was called Reconnect the Nexus. And that project deliberately sought to explore the complexity of the ways in which the food, water, energy nexus worked in children and young people's everyday lives in São Paulo state. We sought to move beyond the large-scale political, ecological, and global debates about the food, energy, water nexus, which are often very abstracted, politicized, and removed from children and young people's everyday lives. Instead, to both center children and young people, to explore what their everyday nexuses of food, energy, and water were, and how those were massively more complex than those global models would demonstrate, but also how they're decentered in those processes too, because those flows exceed them as individuals, they pass them by, they involve and weave together multiple individuals and human and non-human processes all at the same time. And it's so hard to continually think and write those multiple processes together. And that's something we're grappling with in the PANEX-YOUTH project at the moment as we think about our frames for understanding different nexuses. The second project, which was very different, was called Plastic Childhoods. And essentially, it was about the different ways in which plastics are entangled with children and young people's everyday lives. And that, again, sought to both look at what children and young people experience themselves, but to find experimental ways to decenter children for a moment, to move them out of focus, to explore how plastics as objects in themselves cut across children and young people's lives. One way we did that was through a large-scale analysis of social media, looking at eBay and Twitter to explore the circulation of plastics related to children. And a second way was to work with environmental nanoscientists to explore the presence of plastics and other elements in children's bodies through breath and urine testing and in their environments. So without simply falling back into the potentially nihilistic argument that the world is complex, or focusing only on these conceptual methodological questions about how to deal with complexity, once we've established these frames, how do we then proceed? How do we proceed from here in research and practice that can genuinely address the compound, multiscalar, relational, more than human challenges facing vulnerable children and young people in cities?
Thank you, Peter. And Suzanne, we draw a few questions so we can continue discussing. The first one is that, first a comment and then a question, that's following the same structure as before. Well, the pandemic has shown that numerous challenges for children and their communities living in urban vulnerability in a scenario where urban crises accumulate continue to be threatened, have their existence threatened. And meanwhile, knowledge production has been based on the recognition of the need for more interdisciplinary and relational research approaches in which the subjects are engaged with and they participate in this process. And this involves a new focus on non-academic knowledge and social practices. In this sense, participatory research has proven to be relevant in the search and need for greater social involvement in relation to the production, the validation, the applicability, and also the diversity of knowledge. So the question is that from your research experience, I believe you began to talk about this already in your presentation, but we would like to know a bit more about which methodological approaches you believe that allowed to strengthen this encounter between different areas of knowledge, and also between people from the academia, people from non-academia worlds, and especially considering the necessity to account the complexity of urban problems in a post-pandemic context. I would just like to inform people that are watching us online that if they want to make questions to the professors, for them to send them through email. The address is IEA-USP at USP.br. And so I'll leave you to decide who wants to.
Thank you, Luciana. I'm glad that we have this question because I feel that there's so much to say, especially about methods. And I think methods are really at the heart of our work. It's something that I really appreciated to learn more about here in Brazil. And I think it's really important also when we think about, like Peter said, like de-Westernizing science and creating more bridges across different countries and research cultures and disciplines and academics, communities, policymakers to really learn from the ground. And I think for me, getting more engaged with participatory methods really started here at USP. So I think for me it was like a great process also to take this knowledge to the University of Birmingham as well. And like I mentioned, obviously my research faced the challenges of the pandemic, and this required new approaches and kind of figuring out how to translate research into an online setting while maybe being participatory and enabling co-creation. And like I mentioned before, for us, it's really about like this co-creation and like the everyday knowledge of people who actually experience their realities, and kind of the challenge of making this hidden aspects visible. And Lauren talked about this as well, about the hidden part of knowledges. And I think when we also think about the nexus, for example, that came up a few times, it's always how to also engage with this complexity that Peter mentioned, right? And how can we find the right methods? And I think for me personally, when I want to look more into this side of emotions as well, as one aspect that kind of stood out for me as a connecting link, right? Whichever crisis we talk about, whichever interconnections we talk about, it's we're all in there as well in terms of actions, acting according to how we feel. And if we also want to get to a point maybe to inspire positive action, to also give people the self-confidence, to engage, I think at the same time when we do research, we have to kind of also build this confidence. We have to kind of build on the knowledge, but we also have to kind of look at the situation people are in and kind of find methods that kind of engage people not only one by one by extracting knowledge, but really get them talking amongst each other, but also across divides, and kind of abolish the divides of the teacher and the learner. And like Paulo Freire, obviously in his legacy, left a lot of kind of food for thought for that, how to kind of break down these barriers. And I think it's something we should always remember, because I think especially in a world where I think we have like more barriers coming up, I think it's all about like breaking them down and kind of recognizing we're all in a boat together in this. And I think just meeting like the young people from the Rocha, but also this week, yesterday in Paraisópolis, especially people who came from Heliópolis, who are very much engaged, for example, as youth researchers in their own community. It's for us really inspiring to kind of recognize that they are the ones with the knowledge. We as researchers, we can take this knowledge, but I think participatory methods really bring us into this one boat and kind of can flip the coin a little bit to kind of see how we can learn from them. Personally, I think like arts-based methods are a great way to engage with, hopefully going back to the in-person stuff. I think for me, working online, it was a great method. Also, like I mentioned, WhatsApp, I think it allowed me to kind of transform my project into something I hadn't foreseen, and it enabled us also to kind of reflect differently of what we mean by participation, by creativity, by expression, ownership. Maybe young people express themselves in one word, or maybe even in their silences of not replying, but which doesn't maybe mean they don't want to, but maybe they choose to communicate differently, and kind of also learning from how young people actually want to communicate. And I think also recognizing, we are already a different generation, and we need to learn from them if we want to reach, especially young people. We have to understand how, they work, like what works for them, and kind of being open to that as well. But I think my hope is that in the future we get back to participatory methods. I have a new mini project in Birmingham on climate anxiety, where we collaborate a lot with therapists, but also visual arts artists. We go to schools in Birmingham to kind of conduct a series of workshops. It's still very experimental, and I think for me it's a great experience to kind of be part of it and not really know what happens. And I think it's really living with the messiness of the process. I guess always when we do participatory research, it's really like engaging with this unpredictability as well, maybe also feeling less anxious about it. But I think for us as researchers, also engaging with methods that are maybe creative art space, that engage with emotions. I think it's really also about us being in a position that we're able to use the methods, or also engage with the things we talk about. If we want to talk about emotions, we have no emotional awareness, well, I guess it's not going to go really well. So I think we always have to be kind of aware that we are constantly learning as well, and kind of, yeah, really make it a two-way street, I think. Yeah.
So I'd like to pick up on a couple of those things and also mention a couple of others. Four things. The first is co-production, and I guess there's a lot of discussion and debate about what is participatory research, what's participatory action research, what's co-production. One of the projects I'm involved in at the moment is about the future of UK treescapes, so the ways in which we're attempting to plant more trees, essentially, in the UK, and trees of particular kinds to mitigate the effects of climate change, and particularly for carbon capture. The project we're doing, though, is about the ways in which children and young people envisage the future of the UK's treescapes, particularly working with marginalised and diverse communities in city centres. Not the kinds of children and young people who routinely actually access the UK's major treescapes, which are generally outside of cities and tend to be seen as the preserve of the middle class. And the work that we're doing there is in schools largely, but also outside of schools, and involves a very slow process of co-production with children and young people. To the extent that co-production isn't just about the methods, it's also, for instance, about questions of ethics. So we spend an entire session discussing with children and young people what research ethics are, indeed what research is. We spent an entire session ensuring at the very beginning that they know that they are also researchers on the project. And here I'm talking about children who are 8, 9, and 10, not children who are older, young people. And those discussions are really important because they make us think about and often rethink what we mean by ethics, because children ask a whole set of questions that we don't ask in institutional ethical review panels or on informed consent sheets. We use a whole set of terms that are totally irrelevant to children's lives and the things that most of us don't think about in our everyday lives. But it is this slow, iterative process of exploring exactly what co-produced research is. So the first thing to say is we shouldn't think of co-produced research as a finished product or an end goal. It's messy, as you said, Susanna, but it's ongoing and iterative. Secondly, you also mentioned arts-based methods. I wanted to touch on that. So in the Plastic Childhoods project, one of the things that we did was to work with some local artists in Birmingham who do a whole range of interventions, public art projects around issues around the environment, play, and public space. And it's really interesting to work with artists because very often in interdisciplinary projects, artists, or the role of the artist, is perceived to be of a translator, not as a producer of knowledge, somebody who will communicate or visualize the results of social scientists or scientists. But that's not how these artists wanted to work, and nor was it how we wanted to work. And I certainly wasn't going to somehow magically become an artist. I'm not one. So we again, co-produced a method because they were curious to know how children and young people relate otherwise with plastics. The children and young people we worked with were highly critical of plastics for obvious reasons. But unfortunately, like it or not, we're stuck with plastics for the next hundreds, thousands of years. We can't get rid of them, even if we stop producing them today. And so we wanted to think about how else could we live with plastics in ways that are perhaps not so problematic, or at least not as bad as the various ways in which plastics cause health and environmental problems. So we constructed a session where the artist went and collected all kinds of essentially wasted plastics of all kinds, toys, clothes, gardening implements, as many different kind of plastic items as they could think of. They drilled a hole in each one and then brought along to the classroom a vertical stake. We cleared the classroom, and the children were asked to create sculptures using these plastics. And as they did so, they were asked to think of the different kinds of values that the plastics and the sculptures they'd created spoke of. And they began to think otherwise about plastics. They began to have fun. There was a lot of silliness, a lot of creativity, but they also made some really poignant suggestions. For instance, they put some plastic flowers on one of the sculptures and said that although plastic flowers are not as good as the real thing, people might put them on graves if they can't visit them and visit their deceased relatives regularly. So we had some really quite emotional conversations about the possible roles of plastics in our lives. The third thing is the nature of interdisciplinarity is that it is really, really hard. It's really hard. It takes a lot of effort, but that effort is worthwhile. And we need to think in ways that don't just end up reinforcing the fact that in many projects, people just do their disciplinary thing alongside one another. So we need to think of ways of encountering each other's research. And for instance, in the Plastic Childhoods project, after we had collected these data showing the presence of plastics and other chemicals in children and young people's everyday bodies and spaces, we sought to think of different ways in which we could think about where those objects, where those materialities might have come from. And those conversations were often quite speculative. For instance, we found aluminium in quite a high concentration near the school where the children were studying. And unfortunately, we can't tell exactly where that aluminium comes from. Every particle of aluminium, as it happens, looks very much like the next. But what we can do is to begin to construct stories from what children and young people had told us about their everyday movements and mobilities, so where they encountered these elements, and also the histories of Birmingham as a post-industrial city, to construct quite speculative stories, interdisciplinary stories about those material objects. Now, that might not sound particularly robust, but the point is here that science doesn't have the answer. We're not turning to scientists for the answer with these environmental issues. Rather, it's engaging in these kinds of encounters and debates that's key. And this also goes for other forms of environmental knowledge. For instance, in talking with children and young people about carbon, so how much carbon is in a tree, or how much CO2 is in the environment, it's virtually impossible to explain that. It's virtually impossible to explain what 10 tons of carbon looks like. So there are lots of risks, but there are also important ways in which these forms of interdisciplinary collaboration take work, but we need to think about what these kinds of encounters between disciplines might actually look like.
Okay, thank you. Well, we'll go for the second round. Oh, thanks, Gabriela. Well, the pandemic pointed to the multiple risks to the health and well-being of urban children in a context of vulnerability. And a place of invisibility of these subjects predominates, whether they are children or people who live in vulnerable territories. And we can include here the most diverse social context of urban vulnerability, such as women, Black people, indigenous, immigrants, homeless and landless people, among many others. And this context of multiple crises we've been discussing here, they have pointed to the importance of interdisciplinary research to also contribute to the visibility of such subjects, which creates an opening for other paths of production of scientific knowledge, but also other paths of more multiple and plural scientific knowledge that deconstructs hegemonic and universal concepts. And in turn, the transformations in scientific thinking should also be incorporated in the forms of policies in order to promote political changes and guarantee access to rights and the promotion of well-being, especially for the most vulnerable social groups. In the first question, we were talking about methodological approaches. This question is to think about how research turns into policies. So in post-pandemic context, what do you think are the main challenges, possible strategies, and also necessary ways for knowledge produced in academia result in the development, implementation, and evaluation of policies, projects, and actions that actually promote health and welfare for these subjects that live in a vulnerable situation? Feel free to decide.
Thanks, Luciana. So I guess my immediate thought is a question, which is, what is policy? I think policy can be many different kinds of things, and it is different kinds of things at different scales, in different contexts. And therefore, the ways in which we think about how we might work with or inform policy are very much dependent on those contexts. So my own work, for instance, I've been involved as a coordinating lead author for UNESCO's recent publication on its International Science and Evidence-Based Assessment of Education. But I also work with, at a very small scale, with local authorities in the UK at the level of individual cities or neighbourhoods. And the kinds of policies that are created are vastly different. So the first thing is to think about what is a policy and in what ways do we relate to policies as academics. And the same goes for practice and the other kinds of examples you gave. Secondly, I think there's the question of how we work with communities, and again, that's a term that's up for debate, because communities themselves are not necessarily coherent or homogeneous or uniform in their experiences and views. And of course, there are different ways we can work with them as academics, which go beyond going in and doing research, whether it's extractivist or participatory or otherwise. We can amplify voices, so it's not only about reporting the voices of those who remain hidden or marginalized, but about finding ways that we can use our skills, our expertise, simply to amplify the voices of others. And we've talked about that a little bit in terms of the young people we met yesterday who work with observatories in Parasopolis and Heliopolis. Actually, they're doing the research already. They don't need our skills necessarily to go in and do further research with them, but there might be ways in which we could amplify the findings of their research and amplify those voices. There's facilitation, so academics can also use their skills to act as facilitators, to facilitate through skills, through training, in a whole host of different ways. And part of that also links to the convening power that some academics might have. So along with Susanna and a range of colleagues at Birmingham and across some of the countries I mentioned elsewhere, we're coming together as an alliance of kind of networked individuals who work with communities and other academics around the world to think about how we can use that convening power to explore complex issues facing children and young people in ways that are very different across different places, but also connected. So how can we come together as academics and use our convening power to work with communities, with policymakers, with practitioners, with large businesses also, in order to find value, in order to support children and young people's lives. And then just two more concrete examples of the way that I've worked with colleagues with different kinds of policymakers in particular. So for many years, I've been doing research about children and young people's experiences of newly built, master-planned towns and suburbs in England. We work across around 15 different sites in England. Many of these come under the banner of a fairly new policy called Garden Villages and Towns, which seeks to build towns and villages that are green, that are healthy, in some of the ways that we were discussing in the previous session. And in that work, we work with those policymakers, with local authorities, with national agencies, with developers, private developers, in a range of ways. So we comment on policy documents and master plans, we comment on designs, based on the knowledge that we have from the years of work we've done with children and young people. But we also use this kind of facilitation and convening expertise to bring together local authorities with children and young people. Unfortunately, the way that consultation tends to work in the UK is that it tends to only allow those people with the loudest voices and those people who have the time and the confidence to contribute, rarely children and young people. So we've organised workshops with a whole range of activities, including Lego, drawing, role play, which have involved and brought together groups of children and young people of different ages and abilities with planners, with engineers, and with other urban design professionals from both public and the private sectors. And those have often been really powerful. And we try to leave, not in the sense that we will then organise further sessions, but that they then have a template. They have a series of ways in which they could then do that in the future. Rather differently, we are, as part of the Treescapes project I mentioned earlier, working with some very recently arrived asylum-seeking young people from Afghanistan and from a few East African countries. And they're very, very vulnerable young people. But we have a contact with DEFRA, which is our Department for Environment, Food and Rural Affairs, who are particularly interested in the planting of treescapes. And they're also interested in trying to explore the hidden voices of the most marginalised in the UK. So not only children and young people, but the kinds of young people who we're working with. And that's quite a big step. That's very new for them. And again, our work there is about finding ways in which DEFRA are not going to consult with those children and young people. That simply won't work. Many of them don't speak English or don't speak much English yet. They're also very vulnerable and understandably, given the ways in which refugees are treated in the UK, very suspicious of a government organisation. So we're working to, again, try and facilitate and foster encounters between policymakers and young people, for instance, through walks in forested environments, moving outside of a kind of a formal setting to try to foster and facilitate those kinds of engagement. We haven't done that yet. We're going to do it at the end of this month, and we'll see how that goes.
Yeah, thank you, Peter. Great start. I think I have a couple of points I'd like to add to, and I think one thing also Luciana mentioned was the invisibility and visibility, and the first thing that comes to mind when we think about young people specifically, and also the pandemic, but also before and after, you know, the image of young people often being depicted as troublemakers, that actually often we want to get them off the street, put them in their house, you know, kind of forget about them. You know, like we said, pretend everything's normal, you know, just skip ahead 2 years after the pandemics and just, you know, pretend nothing ever happened, that should just be fine. And then maybe just, you know, talk to them again when they're adults, you know, sort of thing, and just ignore, you know, maybe the critical phases maybe of adolescence when we think, oh, they're just complicated, or, you know, and I think just rethinking the concept of young people in a way, you know, of what they have to contribute. And I think it takes to the point of relations as well that Peter mentioned, like the relational aspect of policies, of which young people do we want to talk to, and we should really think diversity and who should be the leading voices. And I think also in UK academia, there's more debates on diversity and inclusion, and I think there's a long way to go still. I think it's great to have the theory, but I think in practice a lot has to happen. I think a lot of destigmatization has to happen. Also, when we think about neurodiverse young people, so we think policies for whom actually are we making? And is it just for the mainstream again, you know, and like who is making the policies, and how many policymakers already in place do we have who also have diverse backgrounds? Is it again just, you know, lobbying policymakers, or is already like knowledge and skills and experience, you know, in place to kind of draw upon? So that's one big one. And I think also thinking about short-term versus long-term impacts we want to make, because often, you know, also policymakers, they want to maybe, you know, to showcase, you know, and have impact case studies, universities as well. We always kind of bound, you know, to kind of show what we're doing, what we've achieved, but what about the long-term impact? It might just take a long time to achieve, or might be really hard to measure, or might even be not very clear to measure, or there might not even be the impact we have been hoping for, or a different one, and what do we actually also understand as impacts? And I think that also takes a bit to the topic of following up on what's being done, and accountability and transparency. A colleague of mine in the School of Social Policy, she's doing great projects with legislative theatre, also based on the Brazilian origin. So Brazil is very present, which is great to see also in UK academia, where they bring together actually young people and policymakers to kind of, act out solutions or challenges and solutions. I think the project was related to homelessness in young people, as a very concrete example of maybe influencing local policies. And they're also aiming to create like a platform where young people can hold policymakers accountable for actually changes that have been then implemented following up on the project. And I think this is a really interesting aspect of thinking how to maybe engage young people not only in formulating or influencing policies, but also holding policymakers accountable as well. So I think that's kind of the main point that I would make. Like Peter said, I mean, what is policy? And I think one example from my own work, it's all, I mean, in fact, with the Horsha, which is also very local, but I think it was for me a very good example of how policymakers and young people can come together, because my research was really supported by the Prefeitura of Franco da Rocha and the social assistant reference centers, and they were really engaged at all levels, from the local social centers, but also to the secretariat. And we had a very good closing event where we had also about 40 people present from different ministries, and the mayor as well. And I mean, even though obviously it's also the higher political level, you have to see what's going to happen, but at least we had the impression that people were very engaged with like different word cafes to really get like into dialogue. And I think just also exploring different forms of just really getting into conversation. And I think again, breaking down the boundaries. I think also just finding new ways of relating instead of, maybe saying, oh, one is from academia, one is from policy, one is from the community. Again, I think we're like all in the same boat together with different expertise, skills, positions, resources. But I think ultimately just finding common ground and kind of see how we can maybe relate differently as well. And yeah, I think that's what I would say about this. Thanks.
Thank you, Suzanne and Peter, for the insightful discussion. I'll leave now the floor for Marcos to bring his own comments and questions for the guests.
Okay. Thank you, Luciana. Thank you, Suzanne and Peter, for the talks. I'll try to make a mixture of comment and some provocations for you to respond, and this will go a little bit through the previous panel as well. I would like especially to recall the Lorraine's idea of rhythm. I think this made me think about the complexity, not only the complexity, but the dynamics, which is not only a complex system, interdisciplinary system, but is also dynamic. And it has a rhythm or multiple rhythms. And this is in the middle of multiple crises, like Gabriela told you. Sorry, Gabriela. Then the complexity is very high. So the main question here in the panel is what methods do we have to assess this this complexity? So Peter brought some ideas of the scale. Scale is important. I think we are focused on children, not in the first panel, but here in this panel, we are focused on children. So just a part of the system. In the panel that Gabriela made a dialogue as more climate change on cities, but this involves the children. So how there are some questions that I think you talked about is about the aspirations of the children. I think you worked with that, right? So how do you structure that? what is the structure of these aspirations of the children? Because there are, when we talk about young people, youth, we are talking about children, and we are talking about people that are older, and the language that we have to use to talk to them. You spoke a little about this. You use the trees and you use the plastics, and you said that I think in both cases you said that the artists are a way to communicate with children. I would like to hear more about this, if possible. Also, Peter brought the ideas of materials and humans. What we use here is, I call the city an herb system. The herb system is the very dynamic of the mixture of the materials that arrive in a city together with the water and energy. And this makes the machine to work. And then you have residues. You never, well, you talked about residues because we were talking about plastics. Plastics are everywhere, but we are well, we hope to get rid of it in a given time. So we are wearing a mixture of cellulose and plastics, and there are plastics everywhere. So we are very much sort of dissolved, or the plastic is dissolved in society. Also, you spoke about interdisciplinarity, and this brings again the rhythm and brings the idea that Peter talked about, multi-generational and intergenerational. This is another complexity, how to assess that. So the main question is, do we have methods for that? And then when you answered the questions, you spoke about co-creation. So Suzanne, co-creation is bottom-up, top-down, or both? Suzanne and Peter also spoke about that. The co-creation, how co-creation is embedded in the access of complexity and interdisciplinarity. I know those are very, very hard questions, but we need methodology to do that. We need objective methodology. The co-creation, co-production. How is the co-production coordinated? What's the best way to coordinate that? Are there objective ways to measure children vulnerability? Do you already have in the project markers or indicators that we can use to see what happened post-pandemic? I interpreted from the last panel that COVID, the cause-effect relationship is what I call complex cause-effect framework. It's not cause-effect with a single cause and a single effect, but these dynamics that Lauren talked about, this rhythm, made that COVID arrived when we were already complex, and this changed the complexity, and created something that, I don't know if this question is more to the first panel, but Lorraine talking about legacy. Legacy, this is a question to the panel, I think, if you want to answer as well, and Gabrielle as well. Did the pandemic made us to adapt? We actually adapted, right? The pandemic finished this week, right? Officially, from the OMS. So we managed to adapt. How this reflects this adaptation capacity that we learned, especially in children, how is this, what is the effect of this capacity that we developed in children and maybe in the society as a whole to confront the problems with the climate change. Was the pandemic a benefit in the end? Is it helping, or the lack of the problems that we had with education, for example, in children, will create a hole, will create a gap for the future? Because they were not in school, but they learned what a pandemic is, what a crisis is, what a multiple crisis is, and what the effects are. And I think we did as well. Another issue is the media. If you could comment on the media as well. I make a drawing based on what you said there. Regarding trees, for example, Peter, we had here the TV Globo, that is the main TV station in Brazil. We started here in this institute, and TV Global, we started a program with the trees from the streets of São Paulo, trying to teach children and adults, because the adults also don't see the trees. There is blindness, the botanical blindness. So this was relatively successful, not very successful, but it helped a little. But this, for this kind of communication, I think we are going to have to discover ways that are more effective than what we did. It was a good experiment, and now I think people can talk about street trees in a different way after we did that. But I don't know. We have to wait for. A couple of weeks ago, I was in a school talking with 4, 5-year-old little guys about trees, and they were very interested. They asked many questions, and this is a sort of communication with their parents as well. So this might have had an effect. I would like to hear what you think about it. There are so many questions. I was sort of lost here. So many things, but I think this is enough. It's food enough for you to comment.
Yeah, thank you. I think a lot of great points. Maybe to get us start thinking. I can start if you like, and then we can swap as well if you want to jump in. Just say so. I think you said the pandemic made us adapt, and I think when we talk about adaptation, we should also talk about maladaptation or positive adaptation. So adaptations can be maladaptive, or they can be constructive. I don't know what the opposite would be, but like positive in a way that help us increase our resilience. Or they might just, we tried to find ways to get by, because obviously most of us haven't had any experience with previous pandemics, for example. We're just kind of thrown in. I think what became, and your question about climate change, did the experience maybe prepare us, to deal with like other challenges? And also, I think I like the thought about like young people missing out on school, but actually having kind of the living lab of the world and the experience, they had, and everything they learned at the same time, not in the school setting. And then also thinking, do schools actually prepare us for what they should? And I'm quite critical in a way of education, and I would like to talk again about also the emotional adaptation. And I think, why do we learn, in schools about like just history and, technicalities of geography, or, but why don't we learn more about like emotional adaptations and linking, I think, the pandemics and the climate change? For me, it's also the word anxiety that young people brought a lot also in yesterday's discussion, which also holds so much for climate anxiety young people feel across the planet, where they aren't really heard, and young people feeling anxious in the pandemic and feeling very much left alone and not considered, and frustrated, and angry, and voiceless. And these are all emotions that speak to the pandemic, but also climate change. And we're still not listening. We still don't really know how to engage with them. And I think young people nowadays, I think there's at least, I think what gives hope is there's a bit of a shift also in naming these emotions and kind of being more open about it. I think our generations and older ones are probably very closed about like actually discussing these things, and it's easier to sweep stuff under the rug and say, oh great, pandemic is over, so let's go back to normal. So what is the new normal? Like young people said yesterday, well, now, we're expected to know these things. We should have learned in school, but we haven't learned them. And then we go to the job market and people just assume we have learned these things. And at the same time, thinking like, how can we be better prepared and adapted? What has to change also in our teaching, our curriculum, not only in terms of content, but also in terms of how we, prepare young people for the future. How do we prepare ourselves for the future? How do we have to relate differently to these topics, and also kind of have a better self-awareness and kind of to acknowledge difficult emotions, not only transform them into humor, which is often easier just to laugh things away, but often under humor there's a lot of grief, there's a lot of kind of loss, like how do we cope with these things, and but also a lot of hope. I think we should never just forget, like, how important hope is, and thinking what gives us hope and how can we become more resilient in the long term. And I think it's really important to come from this scarcity and precarity to kind of this sense of hope, and thinking how can we ourselves transform through maybe critical hope, which implies a lot of action individually but also collectively. So thinking how can we also kind of transform maybe feelings into actions in a way that's kind of productive and not destructive. Also, when we see young people's anger, for example, I think it's often also kind of shows repressed emotions, maybe of grief, of sadness, that have nowhere to go. And I think it could be dangerous if this generation is left feeling just angry and there's no way, for this anger to go. What's going to happen with these young people? And I think it was really impressive to talk to the young people yesterday that talked a lot about also how in the absence of like structural support, like therapy or whatever, they still found ways to maybe, with peer support kind of to cope better. But there were also clearly differences in individuals in their way of being resilient, and just like, functioning or sort of finding ways to still, maintain their mental health, or in a way at least not crack totally. But the question is, how are they feeling today? Are they really okay? Some said, oh no, but I'm fine now. Are they really fine? Are we really fine? I think also for us, this expectation as academics, or any situation we're in, is like to just go back to normal and like just forget, oh, pandemic, yeah, it's over, great, so let's go back, let's do all this. But I think, what did it do to us? And I think the expectation or the hope was in the pandemic to maybe reflect and pause. And many people had this hope in the beginning to kind of have humanity learn a little bit more. But I feel like we have very short-term memories. So I think we should kind of remember all the time, what we can actually learn and how we're really feeling, and be like a bit more honest about that. So I think that's one thing. And like when we talk about rhythms, I think that's a really great one. And scale, I think when we also think about the different rhythms of crisis or different waves. I was at a workshop where they talked about like also plasticity of cities and how we can learn from neuroplasticity of the brain for like urban development and adaptations to crisis. Also thinking maybe one crisis also is at the onset, at the beginning, but another one is maybe phasing out, and like how these different waves also come together, right? Like it's not like maybe, I don't know, the pandemic is ending, but we're still in the middle of, cost of living crisis, and how do we navigate like these different moments of crisis? It's not like the crises are linear. When we talk multiple crises, you can have this idea that everything happens at the same time, at the same rhythm, but it's not, right? And how do we cope with these different rhythms and different waves of crisis as well? But also, how can we maybe learn, from neuroplasticity, for example, of the brain, of relearning and unlearning? But I think when we think about like learning education, for me, it requires a lot of unlearning of things that don't serve us anymore to kind of make room for something new. And how can we integrate unlearning into learning? I think that's for me quite, an important question to ask ourselves. You said methods in terms of how can we, frame young people's aspirations, or how can we talk to them, right? And I think, and you also mentioned, are there any objective ways of measuring vulnerability? Personally, I think I'm a big fan of the lived experience and of the subjective experience. I find it for myself a bit hard to objectify and use indicators. I think it's maybe that's not my discipline, always like finding my way around it. So really kind of in my research on participatory methods, I think maybe the beauty is the messiness. And it also challenges us to live with this uncertainty, because we don't know what's going to come out of it. We want this structure and we want exactly to know what's going to happen. But I guess if we allow ourselves to go with this process, I guess we can find lots of surprises in a positive way of things we're not expected to find. And I think as researchers, thinking top down, bottom up, like of not being from a certain context, we might, come in maybe with our questionnaire and like questions we are asking from our perspective, but the process really allows us to engage with people's experiences in a way we might not expect we would have never asked. So I think for me, the beauty of co-creation is definitely, as well the complexity of the process of co-creation itself, which kind of speaks to the complexity of crisis maybe, and kind of allows maybe young people or anyone who actually wants to engage to address maybe the moments of crisis or the intersections of crisis they find most relevant in the very moment, and find like kind of their own ways of how they maybe want to express their experiences, like for example art, but it doesn't have to be art, it could be anything. And also, like Peter said, he doesn't think he's an artist. I think we all are in different ways. I think it could be writing, it could be drawing, it could just be, I don't know, just engaging in different ways of interacting with nature or with objects. Or you said, like, the plastics project, for example, just looking differently at our everydays. And I think when we try to make the hidden visible, it's really like taking young people out to kind of take a new look at their neighborhoods or at themselves, their lives, a self-reflection process of kind of discovering themselves differently in their environments. So yeah, I think I might leave it here, and maybe Peter has some more ideas.
Thanks, Marcos. Firstly, some really great questions there for us to consider, which will take us, I think, well beyond today's session. So I won't answer all of them, but I'll try and just layer some further thoughts on Susanna's, because I had some similar thoughts, but also extending in some different directions. Firstly, in terms of aspirations and hope, I think, again, we just need to remember that aspirations are not just things that we have as individuals. On the one hand, we're taught to aspire for certain things, whether it's by family, friends, or indeed by governments or teachers or others in authority. In fact, there's been a lot of work in the UK and in some other similar contexts about the production of neoliberal aspirations, the way in which the state deliberately asks children and young people to aspire for certain things but not others. For instance, to aspire to go to university, even if it's not appropriate, to aspire to buy stuff, to aspire to be responsible individual citizens who will take charge of their own lives rather than to rely on the state. So aspirations are not only individual, and I think we have to remember that when we talk about emotions. And that's why, for instance, Raymond Williams back in the 1970s talked about structures of feeling. It's why academics now in a number of disciplines talk about affects, shared emotions that connect us rather than individual ways of feeling. And I think it's important to remember that when we speak of aspirations and when we speak of the language of aspirations, as you asked, Marcos. In terms of methods for complexity, I think the other thing to think about here is theories for complexity as well. We've got loads of theories. We've got assemblage theory, complexity theories, and actor network theories, and way more besides. But also thinking about theories as co-produced. Children and young people are brilliant theoreticians. They're untethered by disciplines or by isms. They theorize about the world all the time. Those theories might not look like the kinds of theories that we write down in academic journal articles, but they're still theories, I think. They're abstractions, and they're really important. So I think thinking about theories for complexity, which are co-produced, as well as methods, is important. Of course, if we think about methods for complexity, there's always a danger that we try to explain everything, literally everything, and that's, of course, not possible. And any attempt at holism is sometimes quite dangerous. Indeed, I guess it's our jobs as academics to cut through that complexity, whether that is through really complex interdisciplinary methods, whether it's simply through, as we're doing in our PANEX-YOUTH project, choosing certain elements of a nexus of complex issues. In our case, play, leisure, food, and education. In another project, for us, it was food, water, and energy. Sometimes we need those starting points and ending points so that we can be clear in communicating the results of our research. And so our methods and our theories need to support that. But I think something we've not talked about, I guess today, and not a subject I know much about, but I'm working with others who do, is the many massive data sets that exist from all kinds of data sets collected by national governments, collected by large businesses, and so on. And there's a lot of work going on at the moment about how can we integrate those data sets. And importantly, those data sets are not only quantitative or objective in that sense, they're also qualitative. They can bring together what public health scholars call the various determinants of health and well-being across data about people's exposure to air pollution, across qualitative indicators of health and well-being and happiness, and across quantitative indicators of large-scale data collected through census or through volunteer geographical information, or indeed through routinely collected data at hospitals or at doctors' surgeries. So we've got loads of methods and data sets, but again, I would ask those questions about what do we mean by complexity, what do we mean by the theories that underpin them, and what is our focus in terms of being clear. Then just about education, I guess, there's an interesting question that came through COVID, which was, I think as you said, Susanna, many people would see it as a missed opportunity to rethink education. We've ostensibly, in Britain at least, gone back to what we were doing before. Very little has changed, other than that we are now prepared to pivot online. And we've seen this with recent teacher strikes in the UK. Moving back online has been fairly seamless. But I, as part of my work, have been working for many years in education contexts outside of the mainstream, where people are trying to do something different, to question what education actually is, what learning actually is. So I've done research with homeschoolers before homeschooling was even a thing with COVID. I've done research about forest schools, Steiner schools, Montessori schools, radical schools informed by Paulo Freire's tradition here. And in all that work, people tried to actually question what education is. What is a school? Can we do education outside of a school? Of course we can. But we've lost that opportunity. And I guess what that shows us is that although we might adapt, that adaptation, of course, may only be temporary, and the questions and challenges that are raised may only be temporary. I think the other thing just to say about adaptation is that everybody assumed that children and young people would be malleable. I kept hearing head teachers saying to me, "Oh, children are fine; they'll bounce back." I'm afraid they didn't. If we look at the many mental health issues that children have experienced since COVID, those are quite long-lasting. In fact, I would argue we don't even know what the effects on children will be over the years to come. So I think when we think about adaptation, we shouldn't necessarily make assumptions about who will adapt and how, and particularly we shouldn't make assumptions about the abilities of children and young people to adapt. We all may be plastic, children may be quite malleable, but they're not that malleable always. And just the other thing I wanted to say, just in terms of the work you've been doing in schools, I'd like to talk with you more about that, because that's something that we're doing in our Treescapes project. And it's this question about the interface between scientific knowledge about trees and how we communicate that, and how children are fascinated about it. But also, what is it that children know about trees, and how do we also validate those kinds of knowledges? For instance, some of the young migrants who we're working with come with different kinds of tree knowledges than we have in the UK, and different ways of relating with trees and understanding trees, different knowledge systems. So how do those come together? We have children who are second or third generation, children in second or third generation migrant families who talk about visiting their grandparents in South Asia and spending time sitting under fruit trees. And they have all kinds of stories about those trees that they want to tell us in these projects. Again, how do we bring those kinds of knowledges into relation with those sort of scientific knowledges that we have? What happens when those different stories come together? And we're still trying to work that through. I don't have an answer for how we should do that, and how we should validate those different kinds of knowledges. But it's just really great to see those knowledges coming together.
Well, thank you for the discussions. I think we'll have some time now to have an open discussion for people in the audience if they have any questions or comments. The people that were in the first panel, I think we might also open for some comments. I don't know if Lauren wants to discuss with a bit of Marco's comments. So I think it's a moment to, the floor is open. So anybody? Yeah, Lauren.
Thank you, Marcus, for the question. I'm just going to focus on your question really on legacy adaptation. And I think a lot of things are going to be open questions and really sort of provocations to some extent as well. I think, I mean, all what you said about the pandemic is true. I think we learn actually a lot. And I think that's the key point is we learn how to adapt. I think going back to the rhythm, we need actually to differentiate the COVID pandemic to any other kind of crisis. And I think, and I do as well, I think there's really some lessons to learn from pandemic adaptations to climate change and other form of crisis. What we need really to keep in mind is the pandemic was sudden, it was unprecedented, it was global, and actually all the adaptations that occurred were almost immediate. They were, as I call them, reactive. And the problem, and I think that's the key problem currently, and it's mainly a policy problem, is the fact that we have moved away from the pandemic. Most of the countries, most of essentially all of the strategies are going back to what seems to be at the top of the agenda. And of course, climate change is one of them. The problem is what we need to learn from the pandemic is how actually we can be very reactive, but bearing in mind essentially what those very reactive measures have on typically the most vulnerable. And I think that's where there's a real gap, is essentially really putting everything in the same basket and really assume that, oh, actually we learned a lot. And I agree, I think if you're looking at education, we actually learn a lot. And I think a lot of schools now, if they had to do it again, they can actually mostly shift remote or online, bearing in mind the fact that there will still be going to be a lot of kids and children, etc., that will be sort of left out. But we learned, that's for sure. I think the problem is really to be able to think systematically and systemically with regard to how those adaptations need to fit with a much wider agenda. And this goes back to complexity, goes back to path dependency. And the problem is really to isolate any lessons and the legacy of the pandemic as a sort of one-off event. Because if we have another pandemic, it may be completely different. We may not have to socially distance, or it may be another form essentially of virus transmission. How and what kind of lessons from this current pandemic can we apply to another health-related event? And I really think that we need to think about climate change differently, because my key concern about climate change, we've been aware of it for such a long time. And actually, when you're looking at it, yes, there are strategies, we're moving forward, we have goals, but it's actually so slow. So what can we do as well just to speed up the response to crises like climate change, and at the same time be really ready to be able to respond to very sudden crises that are not only located on specific places and communities, but really are affecting the lives of everyone, and more importantly, the life of the most vulnerable. So really sort of open questions, but I think the rhythm really is important. It's about really introducing those ideas of temporalities, duration, short, medium, long-term duration, and how this can actually inform the policy. Because we're going back essentially to the role of the state, the goal of the government, unfortunately, in a way, because we know communities know how to respond. But the problem is we can't only rely on local communities to respond. We need essentially to have much structured approach to adaptability. So just wider thoughts on that.
Thank you, Lauren. Does anybody else wants to? Oh, Leandro wants to make a question.
Thank you. So, as both of you commented about the experiences on the studying the water, energy, food nexus, and now in this PANEX-YOUTH project, we also have this challenge on studying the nexus among the access on to education, food, and leisure play. So I also had a previous experience studying the nexus in a vulnerable community in São Paulo. And it was very hard because, you know, this is a global concern about the scarcity, the intertwined scarcity of the chains of provision of water, energy, and food. So in the community, we studied the social practices that could make sense in terms of preserving the flow of resources or the interdependencies or reducing the trade-offs. For example, the way that people used to store water because of the lack of water had sense in terms of saving water, but also saving energy or reducing pressure because you need much energy and water to produce food. The way in which community used to grow food in community gardens, for example, were also benefit in terms of reducing the trade-offs. So we called this positive practices as synergies to the nexus. Now, because there is a big production, scientific production on the water, energy, food nexus, but now I think it's new and challenging. And what we have seen here, for example, in São Paulo, is that a young people in a poor community who lives in a small house had to study online in the scenario of the digital divide. So the inequity in terms of access to internet. In this small house, the youth had to study in the kitchen. But if someone was preparing food, which can be positive, it generates a trade-off in the terms of access to energy or to education. The bad connection, internet connection, is a trade-off both for access to education and for leisure, since many of the options for leisure was, you know, online activities. So I think that besides the challenging of researching through interdisciplinary research, because we could have a research on education, on leisure, or on food access, all of them through interdisciplinary approaches. But they are intertwined in terms of scarcities. So it takes me to the idea that we are researching a hybrid object. It's not a question of three different objects, but a hybrid object, because we cannot analyze each one of them as a part. What do you think about this? We have we still have the interdisciplinary challenge, but dealing with a hybrid object. I would like to hear some comments. Thank you.
A couple of quick thoughts. I guess the first thing is, and I've done this a couple of times, but I think we need to question what we mean by scarcities, because at least for some resources, that there may well be sufficient resources. It's a question of distribution and inequality, not only of scarcity. So it's kind of localized scarcity. So I guess it's just ensuring we always come back to that question. There are indeed in some countries policies in place to address water scarcity, but many critics argue that actually they're not working because the practice of addressing water scarcity has not been properly addressed or resourced. And then, yeah, in terms of that hybridity, I agree, and I think that's something we're still trying to work through. And I think those of us who are interested in these sort of forms of complexity, and indeed, I guess we spent this morning doing that when we were thinking about the different analytical themes that we want to work with in our project. One way we're addressing that is through actually deliberately not looking at food, water, and energy as themes. And I know this is a very specific kind of technical methodological answer, but actually looking at a whole series of other matters that cross-cut them, things like mobility and transport or health, and then exploring specific examples of how those three elements of the nexus intersect. The second is to think about connections, but also disconnections, because I think, Leandro, when you're talking about lack, we're also thinking about disconnections in supply chains or in everyday situations. So another aspect of our approach is to actually visually trace within young people's lives, to get them to do this on a piece of paper, connections and disconnections between different elements of the nexus as they experience it. So I think that those aspects are all important. Susanna, do you have any further thoughts? No? Okay.
Thank you, Peter. I was not going to talk about public policies, but we have a large program of the university now working with that. So answering your question of the nexus, you're working on that, right? Sorry, I forced you to work on that. So the idea of the nexus is not looking at we have 11 different axes like health, environment, etc. And we ask the groups of professors to start proposing nexuses is the plural, is correct, proposing nexuses, three of them, and looking at them as one thing. I think this is the idea, looking exactly like you said, my view at least. You have to three things that you cannot disconnect when you consider the object, and then we derive actions, and from the actions then people gather, and then they design a public policy, and then we polish that using it. This is 150 professors plus 15 postdocs working together only on that to derive. We already have 900 items of agenda to deliver to the government now. This goes a little bit to one thing that you said, that to take the public policies, we are trying to avoid this, at least in Brazil, these public policies that are designed by a politician when they're having lunch on Sunday with the family. And the university are trying to offer that. And the nexus, I think, is key for that, is the first step.
Okay, thank you, Marcos. You want to say something, Suzanne? Okay, so last call for anyone who wants to share thoughts. Yeah? Oh, sure. Let me take you the mic. Otherwise, people online won't listen to you. You can present yourself as well.
Hi, my name's Anna. I'm a PhD student at UNESP, and I'm studying the impact of the pandemic in art, actually, but I've been thinking a lot about education in our society, and I would like to hear more from you, because I can tell, for example, some of the experiments that people want to bring to schools. There's some, for example, let's learn more about African Americans, and then, oh no, let's take this out of the books. Oh, let's learn more about gender. Oh no, let's take this out of the books. So I can see that there's also a war going on when you think about education in vulnerable communities, and how this study and approach from the scholars and academics impact in the society that we are living in after the pandemic.
Thank you. Who wants? Susanna? Sure.
Yeah, I can try to answer. Not sure if I entirely got the question, but I think what you say, I think especially this debate, right, or this conflict of what is or what isn't included in education, I think it's a big one, and yeah. So maybe Peter has some insights from his project as well, I guess, we can say in a second. Because I haven't worked with these kind of different approaches to education, but I think, just thinking critically, yeah, I think it's a big challenge. And I think also when we see, I think it comes a bit back maybe also to information, misinformation, or I think, the polarization of the society and kind of in certain groups having maybe kind of also power to influence in this. I think, I don't know, I can just speak a bit from the UK context where I have at least the feeling, I might be wrong, because I haven't been there for long, but at least my impression was that there is at least a kind of a step up to kind of be more critical in education, or like also include diversity, you know, and at least in public education, or at least in universities as well, to kind of name more issues, you know, like, I mean, kind of this whole agenda we have about diversity and inclusion, you know, and also kind of, like I mentioned before, what about like neurodiversity and these things, and like also talking about gender and LGBTQ, you know, and I think just being more aware of these things, including that more in education, and I think raising a new generation where I feel like the students, at least that we have, are like a step ahead maybe, and have like a lot more access to information. Also comes back to what is education, where is education coming from, how do we educate ourselves, you know, I mean, I think the internet on the one hand side, it can be very positive because we could find so many things, but I guess also, especially in Brazil, the problem with fake news or social media, which can be very polarized, you know, which can be instrumentalized, where again, there's maybe no conversation between groups. I think again, this kind of maybe necessity to build bridges, also we might not want to, it might be easier or more comfortable, you know, to kind of not engage with somebody with a very contrary position, because often people also maybe might not listen, or, you know, we don't feel heard, or we feel like there is no dialogue possible, but maybe still engaging, because I think the risk is when we stop engaging also with the other side, whichever side, you know, somebody wants to be on, right? But I guess I think the importance for me is to kind of maintain a dialogue, to also reach people, maybe also see where do they come from, right? And what is maybe their motivation behind wanting to include or exclude a certain topic, and just understand maybe, you know, the drivers of that, instead of deciding what is included and what is not. It's very more understanding why, you know, what the main issue is, because I think it's kind of a symptom of something more underlying, you know, and also this kind of, yeah, different positions in society. But I think it's very complex. Maybe Peter has some experience with the homeschooling as well, or like, you want to share?
Is there time? How long? Short? Okay. 2 minutes. Okay. So there's a long answer to the question about homeschooling, which I won't give you now. The short answer is there are as many reasons for homeschooling as there are homeschooling families, and that was a very strong aspect of my research. And the nature of the curriculum is just one of them. But in some contexts, it is a very important one. So children are either withdrawn permanently or temporarily, or just from individual lessons, because parents, for whatever reason, don't agree with what their children are being taught. And there have been recent examples in the United States, for instance, around the teaching of evolution, teaching of sexual health, for instance, and about different sexual identities. Yeah, I guess some of what you're also saying is being framed as kind of maybe a bit sensationalist, as kind of culture wars around what is being taught to children in schools. And in the UK, this is in the context of a real kind of doubling down on things like maths and English, to many people's views, to the detriment of other subjects, particularly the creative subjects and humanities. So this is not only a question of what's being taught in terms of substantive content, but the actual subjects that are being taught in schools. A lot of debate around that, as well as a lot of debate, as you've been saying, Susanna, about the teaching of equality, diversity, and inclusivity, or whatever it's called in different contexts, and this idea of decolonizing the curriculum, which has very rapidly gained interest. And I realise the irony of me saying that as a UK academic, talking about decolonizing the curriculum. But that's partly the point, because a lot of it is talk, and that's where a lot of the critique has come in, that in schools, in universities, a lot of discussion about decolonizing the curriculum and some steps to address it, but not necessarily actually doing decolonization. And that is part of these discussions about what should or shouldn't be taught in schools, and those discussions have a lot further to go.
Thank you, Suzanne and Peter. Well, I'm going to finish then our seminar. I want to thank everybody who attend, the audience, all the panelists and the debaters for the generosity of being here with us We also want to thank the Institute of Advanced Studies of the University of São Paulo for hosting this event, and people who are also helping us here with broadcasting the event for people who are following us online, and to also reinforce the importance of these debates for us to do during our research. Thinking here, I'm directly talking with people from the PANEX-YOUTH project, because I think these moments are very important for us to think about the concepts that we are discussing and to continue sharing our thoughts. So I really enjoyed having this moment. And yeah, I think this is it. Thank you all.